Good morning, dear colleagues. Our chairperson, Honorable Dr. Mohammed Isham Jafar of Brunei Darussalam, has to attend to important matters. I have the privilege to take over, and I will do my best to ensure efficiency in the conduct of the proceedings. Before we begin on the next agenda item, proposed resolutions, also called conference papers, have been uploaded on the Regional Committee web portal. These were prepared by the rapporteurs. We will consider the proposed resolutions after the lunch break today. We will now resume our consideration of agenda item 16, specifically item 16.3, WHO's work in countries, document WPR/RC74/10. May I call on Dr. Jujana Jakob to introduce this item, please?
Thank you very much, Chairperson, distinguished representatives. Good morning and welcome again to this Regional Committee session this morning. It is my real pleasure to introduce item 16.3 on WHO's work in the countries. All of you have continued to express strong support to WHO's work in the countries. And after including side events on WHO's work in countries at sessions of the regional committees since 2016, the decision was made in 2019 to make it a standing item on the agenda. This important agenda item serves as a key point of accountability and offers snapshots of the work we are doing with countries and areas in the region. And as we commemorate 75 years of WHO's remarkable journey, this session provides a wonderful opportunity to reflect on the immense progress we have made together to deliver on the region's for the future vision and make a significant impact at the country level. The four thematic priorities of the For the Future have remained at the forefront of our shared efforts to address country priorities and accelerate health for all. The region is rapidly changing, and to respond to new, complex, and evolving challenges, the region is employing fresh and innovative ways of working to ensure sustained and maximum impact. Today, we will hear from many countries across the region on how this collaborative and innovative work is progressing and the impact it is having on the people, communities, and the societies the organization serves. I will now hand over to my colleague, Dr. Rodel Nodora, Acting Coordinator of Country Support Unit, who will be moderating today's session. Over to you, Rodel.
Thank you very much, Dr. Jacob. Good morning, everyone, and welcome to Reigning Manila. To start our Work in Countries session, we would like to firstly greet and celebrate our staff from country offices around the region who are working closely with all of you to implement our For the Future vision. We have put together this video montage, and our country colleagues are also joining us in this session online. The video, please. Thank you very much. It's nice to see our country office colleagues with their wonderful smiles as we together work to achieve our For the Future vision. Today, we share stories from 7 countries across the region that describes the noteworthy progress being made in countries on implementing the For the Future vision. Our first stop is in Malaysia, where we will be joined by Dr. Rabi Abeyasinghe, our WHO representative for Malaysia, Brunei Darussalam, and Singapore, and Datuk Dr. Nurhayati Rusli, the Deputy Director General of Health from the Ministry of Health, Malaysia. With the changing and growing burden of NCDs, innovative solutions are needed. Without further ado, it's my pleasure to invite Dr. Rabi to take the floor. Dr. Rabi, please.
Thank you, Rodel, and good morning, colleagues. It is my pleasure to present this work. Excessive salt consumption is a major contributor to high blood pressure. In 2019, it was estimated that the average Malaysian still consumes 7.9 grams of salt per day, more than 50% higher than WHO's recommended daily intake of 5 grams. In 2013, member states adopted the Global Action Plan for the Prevention and Control of NCDs, which includes a voluntary target of a 30% relative reduction in the mean population sodium intake by 2025. In response, in 2015, Malaysia developed a national salt reduction strategy. At that time, the average salt consumption was estimated at 8.7 grams of salt per day. The aim of the strategy was to reduce the population's salt intake down to 6 grams per day by 2025. This shows what significant progress has been made over the past decade. However, a further 25% reduction is required to reach the national target. A midterm evaluation commissioned by WHO in 2018 found that the strategy had made strong progress. To further accelerate it, targeted interventions were recommended, which included development of a strategic communication approach. As a result, a social behavioral communication campaign was developed and implemented by the Ministry of Health with WHO to encourage behaviors change through salt reduction messages. Firstly, we commissioned a study to survey more than 10,000 street foods across Malaysia and analyze the nutritional content of 94 of the most popular street foods. The data collected was published in a peer-reviewed journal and used to develop a tailored communication campaign for both the general public and school children. The campaign used social media platforms like TikTok for the first time and YouTube to reach a wider audience, especially the younger population. This is important since the dietary habits are shaped at a young age and maintained during life. An evaluation of the campaign materials showed that they were effective in changing the knowledge and attitudes of the target audience, with the social media campaign reaching over 5 million followers on TikTok alone. Despite facing challenges, including COVID-19, the salt reduction program in Malaysia has made significant progress. The progress has been recognized in the recent WHO Global Report on Salt Intake Reduction, published in March 2023, where Malaysia reached the highest score of 4 in the Western Pacific region in terms of implementation of salt reduction policies, the only country to reach this level in the Western Pacific region. The success is due to the strong leadership of the Ministry of Health, as well as active engagement of various partners, including academia represented by University Kebangsaan Malaysia researchers who conducted the street food study, and the 16 TikTok influencers who participated pro bono in the social media campaign, together at the request of WHO. Building on this success, we look forward to continue working together with MOH and other stakeholders to further reduce salt intake in Malaysia. I would now like to invite Datuk Dr. Nurhayati Rusli, Deputy Director General Public Health, Ministry of Health Malaysia, to share with us further details of this initiative.
Thank you very much, Mr. Chair. Can I have my slide PowerPoint? Next slide, please. Maybe next slide. Okay, just an introduction. I think has been mentioned by Dr. Rabin just now. This is one of the risk factor that will impose to the increased burden of NCD in the country, not only Malaysia, but I think globally. So NCDs have been one of the leading causes of death worldwide, and the major cause of premature death. And we understand that high salt intake has been associated with increase in the decreased disease burden of hypertension, which is one of the major risk factors to NCDs. And we have adopted the Global Action Plan for Prevention of and Control of NCDs 2013-2020 with the aim of to achieve a 25% reduction in premature mortality from avoidable NCDs by 2025. Next slide. There are two main issues that we are facing right now in reference to the high salt intake. The other one is increased disease burden of the hypertension in the country. So in view of that, we had actually to have a key data, to provide key data for development of effective implementation of a national salt reduction strategy or program in Malaysia. The Malaysian Community Salt Survey, or MyCOS, was conducted in 2017 to 2018, and the finding shows that 3 out of 5 Malaysian adults assume that they consumed an adequate amount of salt. More than 4 out of 5 Malaysian adults knew the negative effects of salt intake on health, and half of them added salt or sauce and seasoning while eating. So in overall, about 80% of Malaysian adult population consumed more than recommended, which is an average of 7.9 gram a day, which is recommended by WHO, of 5 gram recommended by WHO. Next slide, please. Looking into the prevalence of hypertension among adult population in Malaysia, that we had actually, based on the National Health and Mortality Survey 2019, the result came out as 3 out of 10, or 1 in 3 of the Malaysian adult population diagnosed as having hypertension. It's about 6.4 million Malaysian adults, age 18 and above, in hypertension. And if you're looking into the trend of hypertension among the Malaysian adult population, it shows that even though it showed a slight decrease in the percentage of the prevalence of the hypertension among the adult population, but then it still remained static for the past 10 years with the prevalence at around 30%. Next slide, please. Looking into the street food survey, because Malaysians are very rich in culture as well as food. If you come to Malaysia, people will ask about the teh tarik, about nasi lemak. You can say anything about Western food, Eastern food, Malaysian food, Singaporean food. Even you can have many type of foods at the streets, even the restaurant and so on. So about 64% of Malaysians adults are eating outside at least once per day. So the number of stalls keep on increasing, because I think it's one of the source of income for economic status in Malaysia, and because it is easily accessible, it can easily accessible at any time, even after 12 midnight, and it's time saving as well as very inexpensive. It's not expensive compared to when you go to big food outlets, restaurants, or in hotel. But little that we know the nutritional status of this street food, the content of the street food, including the salt or sodium content of the food. And with the support of WHO, in collaboration with local universities, as been mentioned by Dr. Rami just now, a study on street foods in Malaysia was carried out. More than 10,000 samples were collected and analyzed, and explained by Dr. Rabi, and the sodium content was recorded for 94 most popular street foods. Next slide. Next slide, the next 2 slides, this slide and the next slide, just to share with you on a table of list of street foods being understudied by the WHO as well with the universities. And you can see the quite very convincing food. Yeah, if you go to Malaysia, you come to Malaysia, for sure you can see all these type of foods. The most common foods available around Malaysia, all over the Malaysia. Next slide. So based on the study findings, how the study impact to our policy? So one is on the updating the sodium content in local food or Malaysian food composition database. We had actually database on the sodium content in our local food. We call it a MyFCD, which is accessible to the public, so they can actually make an informed decision when choosing their food of interest. So the second one is to create educational material such as videos, posters, infographics, as been mentioned by Dr. Rabin just now. And very important is that, and this education material is very important for us to educate public, not only to public, the industries, as well as to vendors, but also to our healthcare workers at all healthcare facilities all over Malaysia. Next slide. So what's next? Again, to strengthen the national policies and plans for the prevention and control of NCDs in Malaysia. So Malaysia developing the salt reduction initiative, which is to include the out-of-home sectors by the implementation of so-called MAP or MAP, or namely monitoring, awareness, and product. Next slide. Based on the initiative that's been conducted between MOH, Malaysia, and WHO, the next plan will be, one is to conduct the knowledge, attitude, and practice study among various target groups, including the food handlers, food vendors, to enhance current activities to increase awareness of population on food vendors, and on government initiatives towards provision of healthy foods, on less salt intake, to disseminate information to food handlers restaurant, food premises, and so on to regarding those low salt food, and to explore the legislative approach in controlling sodium content on street foods. Next slide. In conclusion, through clear and realistic stepwise plan of action plan on the 3 MAP or MAP strategies, Malaysia hopes that the interventions will contribute significantly to reduction of NCD burden in the country, in which we target by 2025 we can reduce to 6 grams salt per day. And currently, based on the survey, the current average daily salt intake is 7.9. We hope we can reduce to 6 gram salt average per day in 2025. With that, thank you very much. Over to you.
Thank you very much, Dr. Anor Hayati Rusli and also Dr. Rabi. Indeed, this is a powerful story of how WHO, Malaysia's Ministry of Health, and other stakeholders have worked together to develop tailored communication messages to manage salt consumption, using as well different platforms to increase knowledge, change attitudes, and ultimately behaviors to promote healthier diets. Our next stop is in the Pacific Islands, where we will land in Vanuatu. This time, it's my pleasure to welcome Dr. Samuel Poscay, our Acting Director General of the Ministry of Health of Vanuatu. Dr. Poscay will be sharing the work done on oral health as part of the Health Promoting Schools initiative in Vanuatu. Dr. Poscay.
Thank you, Dr. Rodel, and good morning, Excellencies. Despite having integrated oral health into the Health Promoting School program, the 2017 National Oral Health Survey identified a high burden of oral health diseases, particularly among children. The survey found that 70% of children aged 5 to 7 years were affected by untreated dental cavities, and only 20% of children brush their teeth twice a day. To address this significant burden, the Ministry of Health scaled up its leadership efforts to strengthen oral health by enhancing governance and promoting of oral health in schools across Vanuatu. This initiative is part of a broader health promoting schools program engaging provincial committees set up in the 6 provinces and working with schools to have their own school health policies which capture oral health. As per our first ever national oral health policy for the period of 2019 to 2023, a key objective was to strengthen oral health promotions in schools. To achieve this, WHO and the Ministry of Health together led the coordination, logistic, and training effort to enable school teachers to do daily supervised toothbrushing using fluoride toothpaste. This successful collaboration, along with the support from partners, has enabled the program to be successfully scaled up nationally. The program goes beyond oral health and encompasses broader health promotions, including healthy eating and fostering positive behaviors that contribute to children's overall well-being and long-term health. We are excited to share a video today showcasing a school teacher actively implementing the program and highlighting the positive impact that the program has made.
Me name me Emily John. Me one preschool teacher. Me teach lo community plomi fla lo melamat. Mo me teach one grandson plomi. Maybe some pequenini oli stap lol homes plol katoli no pin sta prasem tu. Petai oli programe oli karamaut lo emi kindi. Me look se ol pequenini oli kam oli learning one new something. We plo prasem tu lo school mo I help mol kata tu plo. Time oli go out lol homes plol katoli sabe prasem tu. Time oli finish kakai. So me looking se programe mi help em all pequenini pick one.
Thank you. Despite the national oral health policy ending this year, we continued in our efforts to address the oral health disease burden. In August 2023 this year, the Ministry of Health, with the support of WHO, organized a national oral health policy consultation to review the current progress. Following this consultation, we are prepared to launch the new oral health policy based on the WHO Global Oral Health Action Plan. Vanuatu will host the next Oral Health Pacific Alliance of Pacific Islands Chief Dental Officers meeting in 2025 to share progress on the Suva Declaration on improving oral health in the Pacific Island region. We will continue to work with WHO to effectively implement national oral health policy in Vanuatu and adopt the life course approach, and appreciates the continued commitment to improve oral health in the region. I thank you.
Thank you very much, Dr. Posicay, for highlighting how Vanuatu and WHO works to integrate programs into broader systems and successfully engage other sectors in our commitment to addressing important health issues such as oral health. Next up, I would like to invite the Honorable Gafar Uherbilao, Minister of Health, Palau, to take the floor to share Palau's efforts to create an age-friendly environment to empower older people and the special role of multi-sectoral action in this endeavor. The floor is yours, Honorable Minister.
Thank you. Good morning, Chair, Acting RD. First, we'd like to commend and congratulate Malaysia and Vanuatu on your wonderful work and partnership with the WIPRO office. It's very inspiring to see that there are a lot of programs on the ground that are helping a lot of people, and this is a very good opportunity to showcase that, and I appreciate that. In Palau, just like many of our countries in the region, the care and respect for the elderly is a cultural duty and a responsibility for all. And Palau is pleased to have partnered with WHO to continue promoting a society that values and supports older people. Our journey in developing our first ever national policy on care for the aging stands as a testament to our strong commitment to creating an age-friendly environment to empower and support older people. In 2020, with the passage of the Senate bill to establish a commission to develop a comprehensive national policy on care for the aging, we began our journey to develop this policy. In response to demographic changes, we partnered with WHO to utilize the operational shift of backcasting to plan our actions to achieve the vision of creating a society that values and supports older individuals. Based on a thematic analysis of focus group interviews conducted with support from WHO, we identified 6 core areas of focus for policy development. These areas covered culture, social and physical environments, health promotion and disease prevention, long-term care, social services, and health systems. What sets Palau apart was the collaborative approach extending beyond the health sector. The Coordinating Committee on Care for the Aging was established with coordination and advocacy support from WHO. The committee is chaired by the Ministry of Health and Human Services, with the membership comprising of more than 7 ministries and councils, as well as community representatives, and includes representation from the President's office. While its establishment was delayed due to the pandemic, this notable inclusive mechanism involves diverse stakeholders, integrating the wide range of perspectives and considerations of the aging population, resulting in a policy tailored to their needs. To advocate for and demonstrate national commitment to healthy aging, with WHO participation, we secured spots for healthy aging panel discussions and presentations at key national events such as the Masil Velao or National Women's Conference and our first ever National Health Summit earlier this year, as well as our first ever National Symposium on Healthy Aging in 2022. Despite challenges, including pandemic-related delays, Palau has remained steadfast and is pioneering the approach of taking early action to address the inevitable issues of population aging in the Pacific. Our story of developing an aging policy exemplifies innovative thinking, cultural sensitivity, and an inclusive approach. From envisioning a society that values older people to creating a concrete policy, Palau's journey serves as an inspiring model for addressing the needs of an aging population. Thank you.
Thank you very much, Honorable Minister Jorge Bilao, for sharing with us how the Beyond Health approach resulted in an inclusive policy development approach under the strong leadership of the Ministry of Health in Palau. This is a great example of how WHO and member states are working together to prepare the challenges of the future, such as the inevitable issues of aging populations. We have heard 3 examples of how our work with countries is making a difference in the area of non-communicable diseases and aging. Now let's travel back to Asia, to the Lao People's Democratic Republic, and we are happy to have with us Dr. Ratanasai Petsuvan, the Director General of the Department of Communicable Diseases Control, Ministry of Health in Lao, and Dr. Ying Rulo, our WHO representative to the Lao People's Democratic Republic. It is my pleasure to introduce this next story on innovative approaches to closing the health equity gap through targeted efforts, local governance, and community engagement. Dr. Ratanasai, the floor is yours.
Thank you, Dr. Rodens, Madam Chairs, Honorable Ministers, representatives from member states and partner agencies, ladies and gentlemen. Good morning to everyone attending these sessions of the regional committee meetings. Today, we will share some success in improving health outcomes among the unreached people in our countries, which is the Lao People's Democratic Republics. We know these topics is of considerable interest to others working for evidence-based approaches. And it is only by doing so that we can achieve the 2030 Agenda for Sustainable Development. By reaching these populations, we can ensure no one is left behind, and everyone can enjoy the highest standard of health. In Lao PDR, business as usual approaches have seen progress in health and health service deliveries, including for hard-to-reach populations. We are very pleased that this has been reflected in reductions in maintenance and child mortalities, reduced prevalence of several communicable disease, and improved access to sanitation and drinking waters.
Thank you, Dr. Ratanasai. Despite successes, some problems have increased or are emerging, such as non-communicable diseases. Other health issues persist, such as tuberculosis, and maternal and infant mortality is considerably high. Unfortunately, hard-to-reach populations are most at risk and often the most difficult to treat. Today, we will present 2 innovative approaches to close gaps. One specific to malaria, involving targeted accelerator efforts towards elimination. The other more systemic, combining local governance strengthening with community trust-building efforts.
Let me briefly describe some of the factors contributing to people remaining unreached. Around 62% of people in Lao PDRs are defined as living in rural areas with varying levels of access to infrastructures or healthcare. Rural development is at early stage with just 28% of our 46,000 kilometers of road currently paved. The government recognizes 49 ethnic groups. This means barrier with language, cultural practice, views on medicines, and trust in health services. To ensure these people are not just reached, but gaps are closed, the Ministry of Health, together with WHO, have been working or exploring new approaches. This requires creative solutions that involve listening to communities and commitments, investment by the ministries and partners according to the community needs.
The first solution we will discuss uses innovative strategies to accelerate malaria elimination. As you can see on the left, 25 years ago, malaria was rampant. People often missed work or school with significant economic consequences. Thanks to work at the village level and beyond, cases have plummeted from an estimated 460,000 in 1997 to just over 2,000 in 2022. More recently, immense progress has been made, and the country is aiming at elimination of Plasmodium falciparum by the end of this year. In 2023 so far, less than 600 cases have been recorded of malaria, with cases found in just 10% of the country's health facilities across 5 of the country's 18 provinces, as you can see on the right side of the slide.
However, these remaining pockets are almost entirely in remote, extremely hard to reach communities. The communities that are now most affected by malaria are those in deep rural areas. They are largely ethnic minority groups. Mostly these groups live and work in heavily forested locations that are ideal habitats for malaria mosquitoes and difficult for health service to get access, posing challenge for the final push or the last mile.
The key is increased outreach efforts by volunteer village malaria workers and accelerator strategies, new aggressive approaches with focus on proactive elimination of the disease. These include targeted mass drug administration, preventive treatment, regular testing for fever, a key symptom, and distribution of long-lasting repellent-treated nets. To assist, WHO has deployed staff in the 5 highest-risk provinces. Beyond regular support, they profile and map high-risk, difficult-to-reach groups and behaviors to tailor responses, analyze data and impact, and modify approaches as necessary.
The second approach is using community engagements to build trust. In rural areas, weak relationship between communities and the health systems can mean limited demands for healthcare, vaccine hesitancy, and poor maternal and child health. The need to accelerate the nationwide or rapid rollout of COVID-19 vaccinations presented a unique opportunities to address this. So the Ministry of Health and WHO and partners have developed the Connect initiative. Some of you may ask, what is Connect? Connect means community network engagements for essential healthcare and COVID-19 response through building trust. So this initiative aims to empower communities and connect communities with local governance and health providers. So can we have the video?
ต้องมาควบคุมกันเนาะต้องรักษาเด็กน้อยอยู่ในท้องเราถ้าว่าเนาะประชาชนบ่ไว้เนื้อเสียใจของหมอน้อยแล้วเนาะเพิ่นก็จะบ่มาบริการเนาะบ่มาควบปัญญาหรือว่าบ่มาฝากท้องบ่มาคือลูกถ้าว่าเป็นแบบนี้ก็อาการตายของเด็กน้อยเนาะมันก็อาจจะเพิ่มขึ้นบริการของของหมอน้อยนี่ก็ ดีหลายดีหลายก่อนตอนสมัยวิธีการ Connect บ่ทันเข้ามาถ้าว่าบ่มีวิธีการ Connect เข้ามาอาจจะสิบ่มีปัจจุบันนี้ก็ดีมีเนาะเพราะว่าวิธีการ Connect เข้ามาก็เพื่อก็ได้ฝึกอบรมหลายด้านเนาะหลายด้านวิธีการเฮ็ดเวียกวิธีการประสานงานวิธีการเว้ากันว่าวิธีการลงบริการเนาะบ่ป้าให้ผู้ใดผู้หนึงเนาะซอยเดียวให้เวียกร่วมกันระดมสุขศึกษาเฮ็ดให้พ่อแม่ผู้นั้นเข้าใจเอารู้มาสักอย่างเนาะวัคซีนทุกเดือนของอยู่ในเกณฑ์อายุสักอย่างแพทย์หมอเนาะบริการกับประชาชนก็ต้องเฮ็ดแท้แล้วก็เฮ็ดจริงใจแบบบ่ต้องเฮ็ดตามหน้าที่เนาะต้องบริการดีเว้าม่วนในใจออกมาเนาะ
Led by the Ministry of Health and the Ministry of Home Affairs and supported by WHO, Connect starts by strengthening local governance capacity for health. We work with district governors to locate sustainable resources, scale up and sustain community engagement, and increase the uptake of health services, including maternal and child health support and COVID-19 vaccination, routine and other childhood vaccinations. The second element brings members of the village, local officials from all sectors, and the community, as well as ethnic group representatives together in a participatory planning process to build trust between the public, local authorities, healthcare providers, and identify gaps in local solutions. Finally, strengthening health professionals' capacity in the technical programs of maternal and child healthcare services, including vaccination, and taking a respectful and people-centered approach. We then follow up regularly via local WhatsApp networks and Zoom to monitor progress and support implementation of their plans while sharing knowledge and experiences between communities.
Last year, the use of Connect ahead of the First Nation Games in many years ensured that 39,000 people in rural and ethnically diverse communities in the Horse Province received a COVID-19 vaccinations. Notably, in 22 of the most challenging villages, the number of people receiving a first dose of COVID-19 vaccines increased by 3.8 times compared to previous outreach efforts. More broadly, anecdotal reports indicate rising trust levels, increased engagements with antenatal care, more childbirth at health facilities, enhanced coordinations at village health centers, and increasing number of official birth registrations.
We are thrilled with these results. So far, Connect has brought measurable benefits to 190 communities across half of the People's Democratic Republic's provinces. The initiative has improved relationships and governance, mapping of health issues, development of local problem-solving strategies, and enhanced local authority and health policy decisions. As a result, Connect is being deployed nationwide by local authorities to improve trust and health equity, address underlying determinants of health, and strengthen local governance beyond COVID-19 and immunizations in a systematic and sustainable way. In conclusion, ministers and distinguished delegates, success is possible with limited resources, but it requires a break with the way we have done things. It requires innovation, a grounds-up approach, investment, and commitment.
The approach we have discussed today are currently being explored for use in other countries and areas. And we look forward to continuing discussions about our experiences and also learning from yours. I do thank you very much for your kind attentions.
Thank you very much, Dr. Ratanasai and Dr. Ying. This is indeed a remarkable effort showcasing how Lao Ministry of Health and WHO have been exploring new ways to reach the unreached and address their unique needs. You have shown us that together, we have put the communities at the center using creative solutions which can be shared and expanded across the country and in other countries in the region. Thank you once again. We will now head back to the Pacific to hear about the accomplishments across the Pacific to respond to health security issues and disasters through the efforts to establish and strengthen emergency medical teams. Our colleague, Mr. Sean Casey, our Health Emergency Officer and Regional EMT Focal Point, is unfortunately not able to join us in person, but he has kindly shared a video recording to tell us more about the work of the EMTs in the Pacific.
Emergency medical teams, or EMTs, are often among the first responders when a disaster or outbreak strikes, deploying immediately to provide high-quality medical care in affected areas, even in the most remote locations or austere conditions. In the past, Pacific Island countries and areas often had to rely on international emergency medical personnel to provide life-saving care following disasters. With the development of national EMTs, many Pacific Island countries and areas have become more self-sufficient when it comes to clinical emergency response. Thanks to a concerted effort since 2017, 13 Pacific Island countries and areas have now established emergency medical teams or taken steps to develop this response capacity. This includes several EMTs which have been established in the past year. EMTs have been established under national leadership, with support from WHO in the form of training, assistance in developing standard operating procedures, and the provision of equipment and supplies for self-sufficient deployments, known as EMT CASH. National EMTs have been instrumental in responding to crises across the Pacific. In 2022, the Tonga Emergency Medical Assistance Team, or TMAT, deployed independently to the kingdom's Hapai Islands in response to a devastating volcanic eruption and tsunami. Last year, the newly established Marshall Islands Medical Assistance Team, or MIMAT, deployed to RMI's remote atolls following the country's first COVID-19 outbreak. Earlier this year, the Vanuatu Medical Assistance Team, VANMAT, was deployed in response to back-to-back tropical cyclones. And in November 2022, after many domestic deployments for COVID-19 and multiple disasters, the Fiji Emergency Medical Assistance Team, or FEMAT, undertook its first international deployment, supporting Tuvalu's Ministry of Health, Social Welfare, and Gender Affairs in responding to the country's first COVID-19 community transmission. FEMAT became the first internationally classified Pacific EMT in 2019 and is one of 12 internationally classified EMTs in the Western Pacific region, with several other teams across the region currently working towards international classification. WHO continues to support Pacific Island countries and areas and countries across the region with the ambitions to have internationally classified emergency medical teams and contribute to regional and global health emergency response. WHO's support for emergency medical teams in the Pacific brings together the efforts of the three levels of the organization and works in partnership with the governments of Australia, the European Union, Japan, New Zealand, and the United States of America. Pacific EMTs and teams from across the region also support one another through regular knowledge sharing, training, and technical support, demonstrating strong regional solidarity and collaboration.
Thank you very much, Sean. As part of the EMT work, there have been great efforts to develop a national EMT in Kiribati. The Honorable Minister of Health and Medical Services in Kiribati, the Honorable Dr. Sinte Sentiang, has kindly joined us to share more about this work. But before I give him the floor, I would like to play another video on the development of the EMT in Kiribati. Honorable Minister, Dr. Cynthia Sintiang, the floor is yours.
Thank you, Chair. Distinguished colleagues, ladies and gentlemen, please allow me to share with you some of the experiences from my country. The Kiribati Ministry of Health and Medical Services is the sole provider of essential health services to the people of Kiribati across our many islands. Our capacity to mobilize surge support to our outer islands when health emergencies occur has been hampered by a combination of transport challenges, human resource constraints, and also our lack of an established deployment mechanism. This has meant that in the past, responses to outer island emergencies in Kiribati were mounted by ad hoc teams formed for that specific event. These teams have never been formalized and typically have lacked formal SOPs and have been challenged with insufficient equipment to sustain the team and enable clinical operations to occur effectively on the ground. In 2019, my ministry committed to formalizing a national emergency medical team capability, and work began to establish our own Kiribati Medical Assistance Team, or KIRIMAT, as we named it. The COVID-19 pandemic and protracted border closures delayed the full development of Kiribati's EMT for several years, but progress, fortunately, did continue. Team members joined virtual WHO Pacific EMT webinars in 2021 and remained engaged throughout border closures and COVID-19 preparedness and response efforts. A technical working group was formed and led the development activities. KIRIMAT team members were formally inducted in November 2022 with a 5-day training session held on the island of South Tarawa, involving a team of 32 individuals made up of doctors, nurses, environmental health specialists, supply and health information specialists. The training was delivered by Kiribati's Ministry of Health and Medical Services together with WHO, using a curriculum designed specifically for Pacific EMTs. Modules covered clinical operations, logistics, and coordination. We saw collaboration across the Pacific EMT network, with Palau's EMT coordinator joining as part of the training faculty, and was able to share the rich experiences from Palau. The training workshop culminated in a 1-day disaster response simulation exercise. This included elements of team mobilization and deployment, mass casualty triage and patient care. The simulation exercise used volunteer actors as patients and required the team to travel with their cache of equipment and supplies using a small boat. With the launch of Kirimet, Kiribati is now part of the global EMT network. This will facilitate ongoing strengthening of national response capacities and improve the coordination of international EMT support should this be required to supplement national capabilities. With the launch of its national EMT, Kiribati now joins other Pacific Island countries that have established or are in the process of establishing their own national and international EMT capacity. Thank you.
Thank you very much, Honorable Minister. This is indeed a powerful story of how Kiribati and other countries across the Pacific are working with WHO to be prepared for any public health emergency that may come. Our next stop will bring us to Vietnam. We will hear from Dr. Angela Pratt, our WHO representative to Vietnam, and Dr. Tran Thi Mai Wan, Director of the Institute of Health, Strategy and Policy of the Ministry of Health, Vietnam. We will hear from them on how health system strengthening through legislative reform is key priority of how WHO provides technical support to Vietnam. Over to you, Dr. Angela.
Thank you very much, Rodell, and good morning, Madam Vice Chair, Acting RD, Ministers, Delegates. It's really a great honour for me to join this session along with Dr. Tran Thi Mai Wan from the Ministry of Health in Vietnam, who you will hear from in a few moments. In Vietnam, WHO, I'm proud to say, enjoys a very close working relationship with the Minister for Health, Her Excellency Dao Hong Lan, who many of you met here earlier this week, and with the Ministry of Health. Earlier this year, I met with Minister Lan to begin a discussion about how our next WHO Ministry of Health cooperation agreement how we can reshape our work together to ensure that WHO is providing the most effective, the most efficient, and the most impactful support. During that meeting, there were a couple of things that the Minister said which have really stuck in my mind even many months later. First of all, she emphasised the importance of WHO's strategic, technical and policy support to Vietnam and how the government sees us as having a comparative advantage in providing this support as the UN's specialised agency for health. And second, she emphasised that her priority as Minister and the Ministry of Health's priority for the next few years is legislative reform to strengthen what she describes as the institutional foundations of the health system in line with the goal of universal health coverage. With several major pieces of health legislation coming to the National Assembly for review, the Minister spoke about the enormous opportunity that this represents to get the foundations, the right foundations in place for the health system that is needed to meet the needs of Vietnam's population, not just today, but for tomorrow, for the next few decades, and the importance of WHO's support in these efforts. So this is really going to be one of our biggest areas of work in the coming few years. Now, at WHO, we sometimes use the term technical support in a fairly generic sense, so I'd like to give a couple of very concrete examples of what this means. So in July this year, for example, at the Ministry's request, WHO convened a workshop on health service pricing. We brought together high-level Ministry of Health, Vietnam Social Security officials with international experts to discuss and unpick a range of very challenging and complex health financing issues. And the advice generated from that workshop will feed directly into planned revisions to the social health insurance law, which we anticipate will be considered by the National Assembly probably sometime next year. WHO is also building stronger collaborations with other stakeholders, including other ministries, the Government Office, which in Vietnam manages the Deputy Prime Ministers and the Prime Minister's offices, the National Assembly, other partners. The Minister often emphasises to me the importance of WHO's voice and influence in Vietnam, and her expectation that we use this voice and influence to influence the policy process and with stakeholders beyond just the Ministry of Health. So in closing, and before I hand over to my colleague from the MOH, I'd like to just say again how proud WHO is to be a trusted strategic partner to the Ministry of Health in Vietnam and to the government on its journey to a healthier and safer Vietnam for the future. And we're really very excited about continuing to provide support in this extremely important area in the future. So with that, it's my very great pleasure now to introduce you to Dr. Wan, who is the Director of the Institute of Health Strategy and Policy at the Ministry of Health, to go into some more details on our collaboration. Over to you, Dr. Wan.
Thank you very much, Angela. I would like to thank the Regional Committee for giving us this opportunity to share on how WHO in Vietnam has supported our health sectors in reforming legislations towards universal health coverage. As Angela mentions, legislative reforms is put as a high priority for our ministers as well as for Vietnam's government to strengthen healthcare systems. Since Vietnam is undergoing rapid economic development and demographic shift with a rapid aging population and changing mobility patterns, which non-communicable disease now the cause of almost 80% of all deaths. Mobility and with this, Vietnam's policy reforms focus on improving quality of care and increasing pupils' accessibility and utilizations of healthcare services at the primary care level. WHO has worked closely with Ministry of Health. The work on legislative reform to strengthen the institutional foundations of our health system in Vietnam is at the top of our list of priorities for WHO support. The role of WHO in Vietnam is very important, and their practical support are diversified, which include preparing policy brief on several key issues, real-time policy advice on some controversial topics as they was being debated in the National Assembly, supporting the government to make evidence-based decisions, facilitating the sharing of international experience, and also convening a meeting of health partnership groups to discuss and give advice for MOH on key issues, as well as allied partner support to the MOH priorities. I would like to give some concrete example of what this support entails. One excellence in long-term collaborations has been on the law on examinations and treatment. And this law was originally adopted in the year 2009. And the revised law on examination and treatment has been approved by the National Assembly in January this year and comes into effect in January 2024. And in this law, the establishment of National Medical Council and organizing exam for practice licensing are new content in this revised law. And WHO has a significant contributions to make this reform. We look forward to WHO's continuing support for effective implementation of this revised law. Other important support from WHO is about development of policy to strengthen primary healthcare and health financing reform related to price setting and regulations, as well as provider payment mechanism reform. I would like to comment on three aspects of WHO support that were particularly appreciated. At the first is support from WHO on legislative reform. It helps strengthening the ability of the government and Ministry of Health to make good decisions based on evidence. The second, in relation to the law on examination and treatment specifically, WHO is one of the very few partners that provide support to improve quality of care. It highlights the importance of WHO's role as a technical agency. Thirdly, WHO is unique in that it also does not just focus on the specific disease. WHO is provide support for the comprehensive approach needed to strengthen institutional foundation for the whole health system, the support for sustainable development. These three elements illustrate the value of our government, of WHO's work as the lead technical health agency in Vietnam and globally. We will continue to draw on WHO expertise over the coming years as we work on series of major health law and policies. Our ultimate aim is to improve the health of all people in Vietnam, and we know that the journey is long. So we look for WHO continuous and increased support along the way to help us to overcome the health sector challenges that Vietnam faces now and in the future. Thank you very much for the attention.
Thank you so much, Dr. Wan and Dr. Pratt, for sharing how legislative reform for health system strengthening is enabling a more equitable, efficient, and sustainable health system with the overall goal of achieving universal health coverage. Our final story brings us back to Fiji. I would like to invite the Honorable Permanent Secretary of Health, Dr. James Fong of the Ministry of Health and Medical Services Fiji, to tell us about the work being done on climate-resilient healthcare facilities. Vuniwai, over to you.
Thank you. I think I've got a PowerPoint is supposed to go up. Just trying to see.
Sorry, Vuniwai, only photos.
No worries. Yes, we were asked in this presentation to outline some of the actions that have been taken by Fiji in its commitments of trying to implement some of our COP26 health program and ensuring that we can contribute to the COP28 program. The Ministry of Health and partners have been engaging in climate change and health work since 2011. And we are prepared to initiate transformative strategies to build resilience to impacts of climate change and reduce carbon emission. We realize that we can't do this alone. And we are envisioning that our other Pacific Island countries will follow us in making the same commitments. We envision that this initiative will open doors for new partners to come on board and also strengthen the resolve for better coordination within the region. We acknowledge that health sector contributes around 5% of the greenhouse gas emissions worldwide, and we can make a difference if we start acting now, supporting the goal of the Paris Agreement. Insofar as the COP26 commitments were concerned, there were three COP26 commitments. One was under the climate resilient health system, where we were asked to do climate change and health vulnerability assessment and use the information from this to update our health national adaptation plan. The second part was the sustainable low carbon health system, where we were asked to incorporate actions that contribute to greenhouse gas emissions by the health sector. The goal is to develop an action plan for this work by June 2024, so that by 2050, the health sector should have reached net zero health sector carbon emission. The third area in the COP26 commitment was to secure funding for climate change and health works. And this was based on by using the vulnerability assessment report and the National Health Adaptation Plan. Fiji has progressed in all three target areas under the COP26 commitment. With the climate resilient health systems, we did a vulnerability assessment from 2021 to 2022. We assessed about 211 healthcare facilities. And we are currently implementing intervention strategies that's with the support of partners like WHO, COICA, and JICA. Proposals are under development and under consideration with donor partners. assessment of vulnerable communities will commence in 2024. Also, what we have done is that the Fiji's first adaptation plan, the Climate Change and Health Strategic Action Plan, has been updated, and we will be launching our Health National Adaptation Plan 2023 to 2030 by December the 1st. The Health National Adaptation Plan highlights 3 phases. We have done the establishment phase during the first adaptation plan that was in 2016 to 2022. And this focused on strengthening surveillance of climate-sensitive diseases and awareness of climate change and health impacts. The enhancement phase will shift the approach to mainstreaming climate actions across all health sector programs, focusing on climate-sensitive health outcomes and not just diseases. And finally, in the latter years of the plan will be the excellence phase, where climate resilient health systems through best practices in the face of climate change and reduction of global greenhouse gas emissions. So that was in the first area of our COP26 commitments. In terms of the sustainable low carbon health system, we have also initiated our multi-stakeholder consultations. We commenced our first meeting of ministers and high-level officials. And as mentioned, the goal of this, the second part is to reach zero health emissions by 2050. My final part of this presentation is really to encourage WPRO members to support and sign on to the COP28 Declaration on Health and on Climate and Health. This declaration is meant to be a political call to action and it also outlines a number of common priorities. It is informed by the Alliance for Transformative Action on Climate and Health commitments. And the attached secretariat is keen to ensure that attached is used as the platform and mechanism to take this momentum forward and to monitor progress of the COP28 onto COP28. The full political statement is in my phone, and I can email it to all those who are interested. We have been talking to the attached secretariat to ensure that we highlight those commitments in this forum. And we are hoping to engage other countries to also join in signing on to this commitment. Thank you.
Thank you very much, Vunuai, for focusing efforts on prioritized facilities for upgrades is really essential in the wider context of inevitable future environmental disasters. With that, honorable ministers, distinguished delegates, as you can see, we have had another productive year and have accelerated our implementation of the For the Future in countries. On behalf of the Secretariat, I would like to sincerely thank all of our speakers, as well as member states and partners who have helped drive the work we heard in the stories today. I would like to hand back the floor now to Dr. Susanna Yacob for some closing remarks.
Thank you very much, dear colleagues. This was a very exciting session, and I'm really happy that this has been institutionalized in the agenda of the regional committee, because it shows your leadership in the countries, which is amazing, and then how we can best support you. And I think with strengthening the country offices, the possibilities in our hands will be even greater, because we try to cover those priority areas in improving the core predictable country presence capacity, which areas were really weak in the WHO country offices. So that is one of the challenges and one of our commitments. And I hope that next year there will be also areas areas of work like prevention, like health promotion, like data collection and health information systems that many of you have raised, where we can give you more support in your work and outcomes. Thank you very much, and thank you for our WRs and the staff in the country offices who are amazing and doing a great job. Thank you, and back to you, Madam Chair.
Thank you. We will now hear from representatives who wish to speak on this item. Please indicate your wish to speak by clicking on big button on your microphone. I call on the Honorable Representative of Australia to be followed. Please, Australia.
Thank you very much, Chair. Good morning, all. And firstly, I just want to acknowledge the work and dedication of WHO staff in the country offices, particularly over the last few challenging years. And we very much welcome the progress that has been made toward delivery on the For the Future vision. And particular thanks to Malaysia, Vanuatu, Palau, Lao PDR, Kiribati, Vietnam, and Fiji for their fascinating and inspiring presentations this morning. It's great to see the practical benefits of WHO partnerships with countries. We welcome WHO's work at the country level in partnership to promote resilient health systems, including through multi-sectoral efforts. And we really are particularly pleased to hear about the work with countries to better prepare for and respond to health emergencies. We welcome the work to develop a 2-year action plan to strengthen WHO engagement with WHO collaborating centres to support countries more effectively and more efficiently. I just wanted to turn to the workforce issues, the WHO workforce. We remain concerned about the ongoing challenge of attracting, mobilising and retaining high quality staff for country offices in our region, particularly in the Pacific. We're keen to work with the region to help develop the pipeline of qualified staff who are available to fill key positions at the country level. And we encourage WHO to take further actions to reduce the time taken to fill vacancies at the country level and to strengthen the strategic approach to recruitment, development and retention of highly qualified, capable staff in country offices. On financing, we acknowledge the importance of sustainable financing for WHO's work in the region. Appreciate the proposed increases to country and regional office budgets under the proposed program budget 2024-25. We all need strong, agile and responsive WHO country offices that are fully staffed with access to adequate resources to respond to country needs. Thank you.
Thank you. May I call on the representatives from China to be followed by the Philippines.
Yeah. Distinguished Chair, distinguished delegates, ladies and gentlemen, the Chinese delegation appreciates the regional director and the WIPRO office for your measures that have taken to use communication to promote health C4H so as to leverage communication in order to improve the attainment of the vision that is common to all of us. We are in agreement with the process of C4H set out in the framework that will help countries focus on core elements of the system, design communication protocols in a reasonable way, and assess the effectiveness of communication so as to further integrate health element into all aspects of decision-making.
China has formed an interagency mechanism for the dissemination of health knowledge based on the needs of the people and the major public health challenges. In 2022, the national health literacy reached 27.78%, 15.3 percentage points higher than the first surveillance result in 1999. In cooperation with the WHO, China has launched a communication for health campaign for salt reduction with satisfactory results. China suggested the Secretariat to promote the integration of the draft framework of action into the current priorities of each country for health communication and provide a platform for the exchange of national experiences and practices and the sharing of content and resources. Thank you, Chairman.
Thank you. May I now call on the distinguished representative of the Philippines.
Thank you, Chair. The Philippines appreciates how the report on WHO's work in countries highlighted our collective intention of reaching the farthest behind, first through cross-country and cross-regional collaboration. We are grateful for the Secretariat's work on continuously improving the development of country cooperative strategies. We believe that the robust multi-sector engagement beyond the health sector is necessary to ensure that the interventions and technical cooperations financed under the new program budget will drive country-level impact and is able to address complex structural issues that causes profound effects on people's health and results in health inequities. We strongly believe that the operational strengthening capacities of member states to steer innovative multi-country collaboration will provide solutions to persistent health system challenges and bring more hope. The Philippines wishes to work with the Secretariat in extending the health services beyond our borders to help reach the furthest islands first. We aim to contribute to island-based solutions to climate emergencies, access to advanced medical and surgical services, and training of health workers to our brothers and sisters in the Pacific. We remain committed to deploy people in major public health emergencies and nation disasters. For disease control, we must never be reluctant about investing in collaborative actions to address vaccine-preventable diseases among migrants, including those considered as stateless populations or undocumented migrants. Cross-border collaboration will only be effective if invisible populations become prominent in cross-border health measures and health financing measures. Finally, women comprise more than 70% of the global health workforce and even a higher proportion of informal workers. Thus, it would be expedient to see gender as a cross-cutting element throughout the report on WHO's work in countries. Thank you.
Thank you. Are there any more representatives who wish to speak on this topic? If not, may I now call on the Secretariat to respond to the points that have been made?
Thank you very much for all your inputs, and we will continue to strive our very best, noting Australia's suggestion of really attracting, mobilizing, retaining health workforce in our country offices to support the countries. We will continue to strengthen the processes, make sure that technical support and assistance is available when needed. And would like to also acknowledge Philippines' intervention of making sure that they are ready to support other countries as well. Thank you very much.
Thank you very much, Rodel. 2 comments on my side. First of all, thanks to delegation for taking the floor and highlighting several issues and priorities, which we always note very carefully and take to our heart. 2 comments. One is about the CCS developments, which is going ahead with great speed, and we are updating the country cooperation strategies with most of the countries. And during this regional committee, we already had the opportunity to sign 2 of them. And obviously, this reflects your priorities. And the starting point is always your priorities, your strategies, your plans, which are then aligned with the regional and with the global priorities. So all the comments on thematic issues are very carefully noted and considered. With regard to the country offices, I fully agree with Australia that they need to be strong. We need strong country offices. We have to fill all the vacancies. And the new delegation of authority that we have provided to the WR serves exactly this purpose, because they have full authority to recruit the staff. And with that, we will avoid the long time that it took to send all the recruitments to the regional office, which is overwhelmed anyhow. So this delegated authority is very important. And we are now working also on 3 sub-regional hubs to help and support the country offices to deliver on the delegation of authority with additional capacity in human resources, in compliance, financing and procurement. And this is also a work in progress. So thank you very much, Australia. We take your comments to our heart. Thank you.
Thank you, Dr. Nodora and Dr. Jakob. If there are no further comments, the committee notes the WHO's Work in Countries report. Thank you. It is now time for our coffee break. The plenary session will reconvene in 15 minutes. Thank you so much and enjoy your coffee. We're out. Thank you, Wipro Dance Company. We now move to agenda item 13, Communication for Health, document WPR/RC 74/7. May I invite Ms. Olivia Law Davis, Regional Communications Manager, to introduce this item, please.
Ms. Chairperson, distinguished representatives, I'm pleased to present for your consideration document WPR RC 74/7, the draft regional action framework on communication for health, a vision for using communication to improve public health in the Western Pacific region. Communication can be a powerful tool for addressing health challenges. When used strategically, communication helps people to know about key health threats and how to behave in ways that protect them, their family, and their community. Strategic communication can also help the region to realise the shared vision of WHO member states and partners to make the Western Pacific the world's healthiest and safest region. We've learnt a great deal in recent years about the importance of using strategic communication, evidence-informed and people-centred communication to change minds, attitudes, and behaviours. And since the beginning of the COVID pandemic, WHO has been working alongside member states to develop, test and strengthen the Communication for Health, or C4H, approach. We've consulted with you and your representatives to develop and enhance the draft regional action framework that's before you today. The challenges have never been greater. The digital age has brought an explosion of information, some good, some bad, and the speed with which it spreads is unprecedented. At the same time, health challenges are growing in scale and complexity. While communication alone usually can't solve complex health problems, it's an essential element of most solutions. Communication that's accessible, understandable, relevant, credible, actionable, and timely is essential to building knowledge, shifting attitudes, and supporting behaviour change to help achieve health goals in nearly every area of public health. The draft regional action framework on C4H and the evidence-informed, evaluation-driven and outcome-focused principles and practices that it outlines should help to close the gap between what is known about how to protect health and what is actually done to protect health. The Regional Committee is invited to consider for endorsement the draft regional action framework on communication for health, a vision for using communication to improve public health in the Western Pacific region. Thank you, Chairperson.
Thank you, Ms. Lloyd Davis. I understand the Secretariat has prepared a video on this item. May I ask to please play the video?
Strategic communication is an essential element of the solution to most public health problems. It can change attitudes and behaviours and persuade people to take actions that protect health. However, the power of strategic communication for health has not yet been fully leveraged. A gap remains between what we know people should do to protect their health and what they actually do. Applying the Communication for Health approach will help countries to achieve their health goals. C4H ensures communication interventions are designed to support the achievement of specific public health outcomes through data analysis, behavioural insights, storytelling, and other recommended approaches. The Regional Action Framework on Communication for Health calls on countries to assess and enhance capacity, dedicate resources, work with partners, plan, test and implement strategic interventions, and measure, evaluate and report on results. Through C4H, WHO and countries across the Western Pacific can help make this the world's healthiest and safest region.
Thank you. We will now hear from representatives who wish to speak on this item. Please indicate your wish to speak by clicking on big button on your microphone. Yeah. Please bear with us. We have a small technical issue here. May I call on the representative of Vanuatu to be followed by Fiji?
Thank you, Chair. Vanuatu delegations wishes to thank the WHO Secretariat to provide the well draft documented and comprehensive paper on the Regional Action Framework on Communication for Health, a vision for using communication to improve public health in the Western Pacific region, and in which we wish to pledge our support for. Thus, in acknowledging all issues discussed in the paper, and in particular, the experience and lessons learned we gained from country response plan to COVID-19 in working together with the technical and financial support from all donor and development partners, including the active participation of NGO and other stakeholders, the country was able to contain the situation. In our view and observation, this was made possible because it was almost a first time ever that the country of Vanuatu and its people have come to face a pandemic of that extent. Vanuatu embraces the current situation of our country where communication for health is becoming more challenging and the need to re-strategize for improving, strengthening of our best methods, approaches to continue to keep our people best informed and seeking their participation and engagement is an ongoing challenge to deal with. While issues and challenges discussed in this paper is well noted, we would like to inform this meeting that a few new challenges observed in communities of Vanuatu, whereby there are more young people, children under guardians such as grandparents, extended families, because their moms and dads are seasonal workers and working abroad, thus listening to health advice or engage in community endeavor for health is difficult due to the lack of commitment, time constraints, finances of the guardians and their extended families. While Vanuatu is still very much customary and culturally driven in most of our communities, the need to identify a stable high chief of respective communities throughout the country and who still has good authority towards his people, thus would be considered as new approach to take on for the good of community communication for all. Thank you.
Thank you, distinguished representative from Vanuatu. May I call now on the representative from Fiji, please?
Thank you, Chair. Fiji acknowledges and thanks the Secretariat for the draft Regional Action Framework on Communication for Health, a vision for useful communications to improve public health in the Western Pacific region. For us, it is a useful framework and a timely one as well. Our COVID-19 experience reminded us that good communication is essential to facilitate effective health response that leads to positive health outcomes. Communication that is credible, contextualized, easy to understand, and timely helps to build trust in our health systems, impart useful health knowledge, and promote healthy habits. It also creates lasting relationships between the health services and the communities they serve. The existing health infodemic, augmented by advances in communication technology and information systems, widespread intelligence sharing, and improved access to information, are also reminding us that our healthcare workers must be good health communicators at all levels of our health system. When good health communication skills and capacities are reserved for a select few, the rest of our healthcare workforce who face the public daily in their own communities are left to create their own versions of the health message, which may lead to error, contradiction, or worse, misinformation. In Fiji, we felt the lack of risk communication capacities internally during the COVID pandemic, and we relied heavily on our health partners to provide the capacity support for the ministry's response. It is now a target of our ministry, and I call on WHO and partners to assist in building capacity in risk communication for behavioral change. In our rural and remote settings, we are requiring of our development partners to package communication capacity into their assistance package. For example, rural electrification of healthcare facilities, which includes setting up adequate power source and voltage for charging cell phones and RT units for communication. IT and internet projects, which include voice over capacities, so that healthcare workers are able to undertake emergency communication with internet access provided. These are support packages that we are pursuing in the area of communication development, and we seek support from our partners in these initiatives. With partner support, we have established our motivational interview training package that trains our health workers on communication and counseling for individuals with individual health problems, particularly those with chronic diseases. Our initial results have been encouraging, and we seek the support of partners in rolling this forward to our frontline practitioners. To conclude, Fiji fully supports the draft regional framework and encourages WHO and partners to support member states in implementing these framework. I thank you.
Thank you. May I call on the representative of Mongolia to be followed by Cook Islands.
Thank you, Madam Chair. Chair, Dr. Jakob, the Acting Regional Director, distinguished delegates. The COVID-19 pandemic has highlighted the need for and importance of strategic health communication. Like the rest of the world, we face significant uncertainty, especially early into the pandemic, when we did not have substantial knowledge and understanding about the virus, its transmission route, or effective treatment. The only tool we could deploy was to use communication as a way to reach the population and advise them to practice non-pharmaceutical interventions to prevent and limit the spread of the coronavirus. This type of strategic communication through regular media briefing sessions proved to be vital to maintain people's trust in the government and have them comply with the measures. However, as the pandemic continued, people got exhausted and the health authorities, unfortunately, were no longer the trusted source of information for the people. Risk communication was inadequate and the false information spread. Yet, we were not equipped with the right skills to fight off the misinformation. Madam Chair, as highlighted in the draft regional framework on communication for health, the right set of skills and strategic health communication requires expertise, skills, and resources. Even before the pandemic started, we had long employed the health communication for a wide range of domains such as health promotion, health literacy, and risk communications, and so on. However, the desired health outcomes were not often achieved. The latest example is our initiative, Healthy Weight campaign, that we launched at the beginning of this year, aiming to support and encourage people to start making small daily changes to their lifestyles and diet and get them started on their way to a healthier life. And over the past months, we ran posters on social media channels such as the Facebook and ran, health professionals' advice on radios and selected TV channels. However, no notable result is yielded yet. Madam Chair, Mongolia recognizes the strategic communication for health as the vital element in solving most of the health challenges we face, and therefore welcomes the draft regional action framework on communication for health. We also would like to request the regional office to provide us technical support on adopting and employing C4H at the country level. Thank you.
Thank you. May I call on the representative of Cook Islands to be followed by Samoa.
Thank you, Madam Chair. Kia ora tātou katoa. I think we will all agree that communication is critical and key in the delivery of any healthcare services. And like the Cook Islands, this has been scaled up during our COVID-19 pandemic response. Delivery of healthcare across a vast ocean is very challenging without effective communications infrastructures. in a costly monopolistic telecommunication environment. While COVID-19 exploited and brought significant challenges to our health systems, workforce, and supply chains, but it provided small windows of opportunities to fill in gaps and strengthen weaknesses in our health systems. Improving health communications was one of those areas. A health system where the outer islands are managed by nurse practitioners, effective communication for remote general health support from public health or oral health, and clinical support is very important. WHO provided support with key equipment for telecommunication, teleconference, and telemedicine support from clinicians on the main island to the nurse practitioners or charge nurses on those remote islands. However, internet connectivity was always an issue. Our government invested into satellite dishes for each of the health center through a private company. Still, the connectivity issue remains to this day. The ministry continues to explore options with local providers and other providers for better connectivity. On a positive note, since the establishment of this service, clinicians on the main islands hold weekly consultations with staff on the islands for urgent clinical consultations or where the need arises. Over the last 3 years, the Cook Islands continue to transform its patient information system and making it accessible to private GPs and NGOs that provide healthcare support services to the ministry. The rollout of our Healthy Island and Smoke-Free Islands initiatives will require such a framework to support communicating our strategies and plans. The development of this draft regional action framework on communication for health will be important to guide developing Cook Islands specific communication strategy. The Cook Islands therefore supports its endorsement. Thank you, Chair.
Thank you. I call on distinguished representative of Samoa to be followed by Marshall Islands.
Greeting to you all, Talofa, Talofa Lava. Thank you, Madam Chair. Samoa would like to congratulate our regional office for developing the draft regional action framework on communication for health as a guiding mechanism to further improve communication for health at all levels. Samoa remains committed to delivering effective public health outcomes. The COVID-19 global pandemic in the past 3 years has demonstrated the crucial role that communication for health plays through the dissemination of accurate health information at all levels. To avoid confusion and fear of unknown, we recognize the need to continue to connect with the public through powerful stories and the importance of multi-sectoral collaboration. For Samoa, we have given importance to communication for health, and it was because of our recent experience with the COVID-19 global pandemic that we have invested our time in prioritizing communication for health through dissemination of accurate health information for preventive health measures, development and implementation of Samoa's rich communication and community engagement strategy, and ongoing multimedia campaigns on different health issues that the public needs to be informed of. In summary, Samoa fully supports the recommendation to endorse the Regional Action Framework on Communication for Health. Fa'afetai. Thank you.
Thank you. May I now call on representative of Marshall Islands to be followed by New Zealand.
Madam Chair, Excellencies, ladies and gentlemen, Marshall Islands underscores the importance of working in unison, that we must work and translate our commitment into practical action, especially for the most disadvantaged populations. Communication for health is one of the regional strategies we believe is important in RMI because it is a catalyst for positive change towards many health issues such as adolescent health and family planning. The RMI has the highest rates of teen pregnancy in the region. In 2022, 1,044 babies were born. Of these, 192 were to mothers 19 and under, including 3 to teens under 15, the most in this age group in at least 5 years. To help address this challenge, our ministry recently engaged with the newly crowned Miss Marshall Islands, Miss Clara Chongam, together with her sister colleague atoll contestants, to raise adolescent health issues, especially on teen pregnancy, mental health, youth development, and disability. Significant efforts have been made in the last 6 months, I'm very proud to say, to address adolescent health, where workshops have been created through this engagement to raise issues on misinformation, safe open forum for sharing of information, and factors related to traditional cultures and gender norms in families and communities. The RMI acknowledges the consultative process of the WHO to achieve a regional roadmap aimed to understand health communication gaps, opportunities, and engage discussions on how to best develop this policy. In this connection, RMI renders its support to the draft regional action framework on communication for health presented under this agenda item. We also commend Malaysia, China, Fiji, Papua New Guinea for the able leadership in sharing their best practices. Thank you, Komodada.
Thank you. May I now call on representative of New Zealand to be followed by Australia.
Thank you, Madam Chair. Tēnā koutou katoa. Aotearoa New Zealand endorses the Regional Action Framework on Communication for Health, a vision for using communication to improve public health in the Western Pacific region. Aotearoa New Zealand acknowledges the significant role communications have in shaping individual and community decisions in the context of public health, including an emergency context. The way we communicate around public health needs to work for the communities we serve. We must constantly evolve to ensure we provide timely, clear, and credible information in easy to understand ways. Listening and learning is key. At the outset of the COVID-19 pandemic, our strategy focused on ensuring information across all mainstream channels was reliable, up-to-date, reaching all sectors of the population. This helped the public to stay well informed. But as our public health response to COVID-19 shifted, so did the way we communicated for health, particularly for harder to reach Māori and Pacific communities. For example, a key approach to delivering effective communications to Māori and Pacific communities was to engage with iwi or tribal community leaders and Māori and Pacific health providers to understand what communication approaches work best for them. We then invested in creating empowering partnerships that enabled them to produce their own communications and models of care tailored to their specific population needs. For Māori, this community outreach approach, along with the use of online channels and digital technology, helped Māori providers reach whānau who had not previously engaged with the health system. Immunisation data indicates that Māori providers delivered more than double the doses of the COVID-19 vaccine to Māori compared with sites without this approach. Looking ahead, we will continue integrating what we have learned into our future health emergencies and broader public health initiatives. We see the potential of the Communication for Health framework guiding how we effectively utilise the range of tools and methodologies at national and local levels to support better and more equitable health outcomes in Aotearoa, New Zealand. Ngā mihi nui, thank you.
Thank you. I call on the representative of Australia to be followed by Tuvalu.
Thank you, Chair. Australia would like to thank the Secretariat for developing this important, clear and strategic framework. As we have all experienced during the COVID-19 pandemic, strategic, healthy communication is paramount to enhance health outcomes. WHO has a vital role to play, and this framework is a very valuable contribution to strengthening communication for health in our region. Health communication is most valuable when it is informed, researched, evidence-based, and targeted so that it achieves real public health outcomes. We recognise that public messaging and communication has a significant role in promoting the health of all. We appreciate the focus on addressing the infodemic and leveraging partnerships to enhance the implementation of communication for health initiatives, particularly in addressing complex health challenges. We welcome the presentation of different country initiatives in the framework and thank our colleagues for sharing their experiences, which we can all learn from. We look forward to further WHO efforts to share learning and good practice across our region and encourage WHO to continue to strengthen efforts to combat misinformation in partnership with member states. Thank you.
Thank you. May I call on the representative of Tuvalu to be followed by Solomon Islands.
Thank you, Madam Chair. Communications for Health plays an important role in enabling individuals to make informed decisions on the importance of health issues. One of the pivotal tools that public health has used to get messages across to make sure target audience and general populations makes well-informed decisions on health-related issues. Nowadays, there are lots and lots of available means of communication and platform that can be utilized to communicate health issues. In our context in Tuvalu and across the Pacific, we have been using lots and lots of communication strategies to counter all escalating health-related issues that we are facing right now. We have noticed a slow response, and it takes so long for the people to change their behavior. That becomes a challenge for us. There are some issues we tend to share and convey information very often and so many times, but still we don't see much improvements on it and still on the rise. The best practical evidence that we have noticed in the continued rise of prevalence of NCDs, lifestyle disease. In the Pacific, despite the many health populations program that we have created and many support the region has offered to support Pacific Island countries, things still don't turn out to what we expect to see. However, at some stage, we have seen the importance of communications for health in our effort to try to roll out COVID-19 vaccines during pandemic. And I'm sure the majority of member states faced the same situations with lots and lots of anti-vax. Despite the challenges, communication plays an important role in enabling people to make well and best informed decisions on importance of being vaccinated to protect them from COVID-19. With lack of communication specialists in our setup in Tuvalu, and I sought continued support of WHO on the provisions of specialized and technical assistance and support in the area for people to assist us in improving and enabling the capabilities of our local in the countries. I thank you, Madam Chair.
Thank you. I call on the representative of Solomon Islands to be followed by the Philippines.
Thank you, Madam Chair, for this opportunity. Strategic health communication has long been a critical tool in Solomon Islands' public health arsenal. Through strategic communication, we continue to explore new ideas, overcome challenges, and identify spaces for improvements. Ensuring that all Solomon Islanders remain safe and healthy requires rapid and effective communication for preparedness and response during disease outbreaks, natural disasters, as well as creating public awareness about emerging and re-emerging diseases, such as the recent
COVID-19 pandemic. Solomon Islanders face a triple burden of diseases of communicable disease, non-communicable diseases, and the climate crisis. Rapid and effective two-way communication is critical for prevention, advocacy, and effective public intervention. Embedded in our new National Health Strategic Plan is the vision for a healthy future for all. Having an effective communication strategy will be critical for leveraging resources and rallying multi-sector engagement in order to achieve its strategic objectives. Specified in our National Health Promotion Policy 2020, all national health policies and programs must develop, implement, and evaluate an evidence-based strategic health communication plan, which is localized to the country context and empowers and engages communities to protect themselves. As the Solomon Islands continue to strengthen its health system, it is looking for innovative communication approaches, capitalizing in the advances in digital technology in order to reach more people than ever before. Harnessing its power can enable changing knowledge, attitudes, behaviors, and practices to enable individuals, families, and communities to make well-informed choices. We believe the Communication for Health framework will provide useful guidance in communicating health policies, programs, and service delivery. Solomon Islands therefore endorse the Regional Action Framework on Communication for Health. I thank you, Madam Chair.
Thank you. I call on the representative of Philippines, to be followed by Brunei Darussalam.
Thank you, Madam Chair. The Philippines recommends the adoption of the Regional Action Framework on Communication for Health. It builds on shared experiences among member states on the value of communication and the use of C4H in the region. The framework speaks of improving health literacy to improve health outcomes and achieve equitable health care in every nation. C4H ensures that promotive and preventive health services are given equal importance as therapeutic and rehabilitative health services. We need to ensure that muted voices on global health discourses are finally heard. C4H will help us achieve health equity by enabling us to listen closely to the unheard and make informed judgment and adjust our policies to amplify voices of those who are left furthest behind. Given the breadth of the C4H framework, it is important to further refine the tools and techniques and identify the context and health challenges in which they are applicable. We look forward to working with the Secretariat on a clear monitoring, evaluation, and learning framework that measures process outputs, behavioral outcomes, and broader health impact. A capacity framework and plan to be implemented from national to subnational levels is necessary. WHO technical guidance on the operationalization of the C4H in relation to existing frameworks of risk communication and community engagement in the IHR and the disaster risk reduction management framework would be beneficial. Finally, we also recommend strengthening support for the development of systems for social listening and the translation of signals into actionable insights at national and subnational levels. Thank you.
Thank you. We now call on the representative of Brunei Darussalam to be followed by Malaysia.
Thank you, Madam Chair. Bismillahirrahmanirrahim. Assalamu alaikum and good morning. Chair, Excellencies, delegates, ladies and gentlemen, Brunei Darussalam welcomes the inclusion of communication for health on the technical agenda for this RCM. We are pleased to note that the proposed Regional Action Framework on Communication for Health builds on a range of disciplines and communication approaches that have been used successfully, not least during the response to COVID-19, to inform, change attitudes and behaviors, and help improve health at individual and societal levels. While we endorse this action framework, we wish to highlight three key elements from this document that merits further consideration. First, despite significant progress in applying strategic communication to address public health challenges, a gap persists between what we know individuals and communities need to do to improve their health and what they actually do. Here, it is important to recall that even highly health literate individuals do not necessarily translate knowledge and attitudes into real life practices. This reiterates the need for greater understanding on drivers for action at the individual, collective, and institutional levels. Such drivers are shaped by economic, environmental, and social determinants of health, many of which are not amenable by individual action alone. There is also a need to build capacity to systematically adopt evidence from behavioral insights and implementation science to not just change behavior, but to sustain behavioral change. Second, we applaud the people-centered approach that sits at the heart of the Regional Action Framework. We must build on work already being undertaken to listen to the concerns of communities, to better understand the drivers and obstacles to change on specific health issues. Our communities are not just passive listeners or consumers of information, but as the framework notes, are also originators and co-creators of communication. In our experience during COVID-19, engagement with both traditional and non-traditional media, such as social media influencers and local personalities, paid off with momentum generated by local grassroots efforts, serving as counterweight to small pockets of misinformation on social media. Finally, we note the importance given to digital tools to support communication for health initiatives within the framework. For many, life is driven more than ever by information technology and communication. While the relative ease of information access may also enhance susceptibility to disinformation and misinformation, we recognize that the secure use of information and communication technologies in support of health has the potential to improve the quality and coverage of health services, increase access to health information and skills, as well as promote positive changes in health behaviors. Our experience has shown that digital technology represents a key milestone in how we engage with the public and deliver public health interventions that lead to sustainable behavioral change. Thank you.
Thank you. I now call on the representative of Malaysia to be followed by Cambodia.
Thank you, Madam Chair. Malaysia fully supports the endorsement of the draft Regional Action Framework on Communication for Health. This framework ensures communication efforts are well planned, based on evidence and designed to influence the cognitive effective and behaviors which ultimately leads to achieving specific public health goals. The communication landscape is undergoing swift transformations driven by the rapid digitalization and the widespread proliferation of social media platforms. Therefore, it is imperative that we enhance our capacities and bolster our competencies in order to confront the forthcoming and unpredictable health challenges in the future. In April 2023, Malaysia had actively participated in a member states consultation on the draft Regional Action Framework aimed at strengthening the implementation of communication for health. We are pleased to observe some enhancement in this document as expressed by Malaysia and other member states involved. This regional framework aligns with WHO draft resolution on behavioral science for better health, which Malaysia recently proposed and adopted during the 76th World Health Assembly. The resolution promotes a multidisciplinary approach, including communication as one of the key components of improving health outcomes through behavioral science. As Malaysia aims to play a pivotal role in the behavioral science agenda, efforts are underway to integrate this agenda into the healthcare system. With the establishment of the Behavior Insights Unit under the Ministry of Health Malaysia, we are in close collaboration with the WHO Country Office for Malaysia, Singapore, and Brunei Darussalam to implement behavioral science functions at the various divisions within the Ministry of Health Malaysia and at the state health departments. This will further strengthen the development and execution of policies and interventions through behavioral insights. In addition, Malaysia has already initiated capacity building programs among health professionals within the Ministry of Health Malaysia, focusing on utilizing behavioral science, especially through effective communication as a tool for driving social and behavioral changes. Thank you.
Thank you. May I now call on the representative of Cambodia to be followed by Vietnam.
Honorable Chair, Excellency, ladies and gentlemen, Let me begin by saying that as one of the first country in the region to receive dedicated C4H technical support, Cambodia is pleased to endorse the draft regional action framework on C4H. The vital role of communication to work alongside other public health intervention to improve outcome and extend life cannot be overstated. As was abundantly clear during the COVID-19 pandemic, strategic communication can have positive impact on health at individual, community, societal, and it can help member states to achieve our public health goal. Across the world, we also witness that the lack of evidence-based, robust, cohesive public health communication can lead to confusion, disruption, and the spread of misinformation and disinformation. The full power of strategic communication for health has not yet been fully leveraged. There is still a gap between what people should do to protect their health and what they do. And this framework is welcome step to integrate this emerging technical area in health system across the region. Cambodia was the first country in the region to host Youth Innovation Hackathon on AMR in August this year, 2023, as part of the first 5 communication plan for AMR in the Western Pacific region. This interactive and participatory hackathon was the first step in develop and disseminate an innovative communication campaign about AMR in Cambodia that will be rolled out in late this year, 2023. C4H is included as a cross-cutting and enabling mechanism in new Cambodia WHO CCS 2024-2028, and in anticipation of the endorsement of the C4H framework, we have begun process of mapping C4H at national and subnational level. Cambodia would like to request the Western Pacific region to allocate more funds for implementation this new action framework. I thank you very much for your kind attention.
Thank you. I now call on the representative of Vietnam to be followed by the United States of America.
Thank you, Madam Chair. The COVID-19 pandemic brought significant levels of mis and disinformation. This has heightened the importance of a more comprehensive approach to strategic communication as a public health intervention in Vietnam and many other countries in the regions. It has also increased the urgencies of applying communication for health thinking to health emergencies and another priority area of work. During the pandemic, as a part of Vietnam's risk communication approach, the Ministry of Health deployed several interventions that were in line with the communication for health approach. This included social listening, evaluations, communications campaigns informed by data, and community engagement. The Ministry of Health also used storytelling as a way to influence key behaviors to help keep the community safe and reduce morbidity and mortality. Going forward, we welcome WHO's aim to work more closely with member states in the Western Pacific on communication for health. The priority in Vietnam are building communication for health capacity and developing communication interventions that are informed by data and grounded in audience listening to address current and future challenges to health, including preparing for and responding to health emergencies, as well as for behavior change. The Ministry of Health appreciates the close collaborations we have had with WHO's Vietnam Country Office over many years. We're now looking forward to more collaborations by introducing communication for health principles more broadly to help Vietnam become a healthier country. Thank you, Madam Chair.
Thank you. I now call on the representative of the United States of America to be followed by China.
Thank you, Madam Chair, Acting Regional Director, distinguished delegates. The United States supports WIPRO's efforts to strengthen health communication, understanding the importance of health communication as a tool to improve health and well-being. The United States believes an equity-centered approach to inclusive health communications is critical. We know that a shared terminology and narrative, which is consistent with how audiences see and understand themselves, can reach more people and be more effective. This includes culturally and linguistically appropriate communication materials that are tailored, context-specific, and tested to ensure that they are useful to the audience, and the use of trusted messengers in communities and on social media. Health misinformation and disinformation also continue to be serious threats to public health. The infodemic, including both health and misinformation and disinformation, has led to negative health consequences, confusion, rejection of certain public health measures, and harassment of public health professionals. We support evidence-based strategic communications to address complex health challenges and to counter health misinformation and disinformation. As a whole of society, multi-sectoral approach, including community engagement and partnership with trusted messengers. In summary, the United States supports this draft regional action framework on communication for health. We welcome the opportunity to work together with WIPRO member states in an evidence-informed and evaluation-driven approach to increase health literacy and trust in public health institutions, and to identify and address misinformation and disinformation for improved health outcomes. Thank you.
Thank you. May I call on representative of China to be followed by Hong Kong, China.
尊敬的主席 Honorable Chair, delegates, ladies and gentlemen. First, the Chinese delegation would like to thank the WIPRO office for their actions to promote communication for health. China highly commends the draft framework for action on communication for health. China commends the proposed communication for health process, and we believe it will help countries to scientifically design their communication plans, to timely evaluate communication effects, and further place health in all policies. China always makes health literacy improvement as the prerequisite cornerstone for universal health coverage. Among the 15 actions of the Healthy China campaign, popularization of health knowledge is action number 1. We inform residents of health knowledge, we equip them with skills, and we roll out appropriate technologies and supportive tools. A cross-sectoral omnichannel mechanism for publishing and communicating health information has taken shape. China also collaborates with the WHO on communication for health projects and delivered great impact. China suggests that the Secretariat can promote the alignment of national communication for health projects with this draft framework of action. And the Secretariat can provide a platform of experiences and information sharing so that we can have a cross-sectoral and intergovernment communication for health collaboration system for the region. Thank you, Chair.
Thank you. I call on the representative of Hong Kong, China, to be followed by USA territories.
Thank you, Madam Chair. Distinguished guests, ladies and gentlemen, Hong Kong, China is fully committed to safeguarding people's health. I'm glad to say that all along, our health communication approach is in line with the principles and practices of communication for health. We appreciate WHO's effort to have worked out the draft regional action framework on communication for health, a vision for using communication to improve public health in the Western Pacific region. We support and endorse the draft framework. On health promotion, Hong Kong, China conducts researches on various health topics to gather relevant local data and incorporates latest scientific evidence in developing our communication strategies. Moreover, we have all along maintained close partnership with relevant stakeholders in the planning, implementation, and evaluation of health promotion programs to ensure that they are people-centered. For specific diseases, special groups of stakeholders will be engaged in the planning process as appropriate to ensure that the programs could meet the needs of certain high-risk groups. The COVID-19 pandemic has highlighted the importance of strategic health communication. Like other member states in the region, we have faced many challenges during the battle, but have also gained valuable experience from it. During the pandemic, we continuously collected and analyzed data of COVID-19 patients and their vaccination status. The information also helped us to identify at-risk groups and make a timely adjustment of our publicity actions in a targeted manner. For instance, at certain points during the pandemic, epidemiological evidence showed that the ethnic minority groups, which accounted for about 8% of the population in Hong Kong, were at risk of COVID-19 outbreaks. We then strengthened the publicity efforts targeting at the ethnic minority groups and collaborated with the opinion leaders and NGOs to help promoting vaccination and preventive measures in a timely manner. Health information was disseminated through diversified online and offline platforms using traditional and new digital media channels, such that all sectors of the public can grasp the latest information accurately. The draft framework provides clear guidance with enlightening examples. We look forward to continuously working closely with WHO and other member states to improve public health in the Western Pacific region. Thank you.
Thank you. I would like to invite the representative of the U.S. territories to make the last intervention before we break for lunch.
Thank you, Chair, Acting RD, distinguished delegates, ladies and gentlemen. Hafade Zantiro, a warm island greeting from the United States territories. We strongly support the draft regional framework, Angola WIPRO's efforts to strengthen health communication, and we welcome this opportunity for exchange. We need to keep grounded in what has worked within the territories through the localization of information by using community members and leaders, people our communities trust, in addressing misinformation and disinformation driving public health messages. We all have a message, often in story form, to convey, and the support of member states in the delivery of these stories is essential to improving the health outcomes of our people. From our community leaders that provide authoritative and evidence-based messaging to community members that provide peer and experienced ones, we must ensure that health information is presented in a clear, jargon-free manner that is easily understandable by our people, with language that respects and considers cultural and linguistic diversity. We thank the WHO and WIPRO as there have been great strides in our region in using a multi-channel approach that entails the utilization of multiple platforms of communications via websites, social media, mobile applications, and traditional media to build and reach broader island communities and audiences. With those advancements in communications, continue the importance of timely and thoughtful perspectives in delivering messages to our region's specific groups and demographics to make them more relevant and relatable. Chair, ladies and gentlemen, America and Samoa in absentia, the Commonwealth of the Northern Mariana Islands and Guam support the draft regional framework and opportunity to work together to identify and address misinformation and disinformation and increase health literacy and trust in public health institutions in the Western Pacific. I thank you.
Thank you. We will now suspend this item and break for lunch, but before breaking, may I remind the committee that we will take up the proposed resolutions after the lunch break. And one last small administrative announcement. May I remind the committee that there will be a side event on climate resilient and low carbon health systems at 12:45 hours here at the plenary hall. May I now call on the Acting Director, Administration and Finance for the administrative announcement.
Thank you, Madam Chair. Just a very quick announcement. If there are any changes in the return travel itinerary for any participants, I would kindly ask you to either report to the inquiry desk located in the foyer area or to your liaison officer. I think that would facilitate a smooth return travel for all of you. So I just wanted to mention that. With that, back to you, Madam Chair.
Thank you, Mr. Agarwal. We will now break for lunch and reconvene at 1400 hours this afternoon. Thank you very much.
Thank you.
Good afternoon, honorable ministers, distinguished delegates, acting regional director, partners, colleagues, and friends. Welcome to this important side event on climate resilient and low carbon health systems. Climate change, environment, and health is an important thematic priority for the region. And the subject of how the healthcare sector becomes resilient to the impact of climate change, as well as become low carbon by itself, is very critical. To set us off with an overview of the criticality of this subject area, without further ado, and before I introduce the event, I would like to welcome and invite our acting director, Dr. Susanna Jacob, to give us an opening remark. Dr. Jacob, the floor is yours.
Thank you very much, Akim. Honorable ministers, respected member state delegates, valued partners, good afternoon and welcome back, and apologies that again we are shortening your lunch break. At the core of our objective is protecting health and well-being of our population. We have a shared vision in the Western Pacific region, which calls for new thinking and new ways of tackling the growing impact of climate change and the environment has on health. Climate change is not merely an environmental crisis. It is fundamentally a health crisis demanding our collective action. The commitments made by the countries at the United Nations Climate Change Conference in Glasgow, the COP26, highlighted the global dedication to counter climate change and its health implications. Furthermore, the WHO-led Alliance for Transformative Action on Climate and Health initiative is leading the way in building climate-resilient health systems. I commend countries for their efforts and Fiji and the Lao People's Democratic Republic for their exemplary actions. The region is experiencing diverse health impacts from climate change and environmental factors, including challenges from air pollution and the after effects of extreme weather events on coastal and island communities. In addition, climate-induced extreme weather events damage healthcare facilities, affecting essential health service delivery. It is crucial to strengthen the resilience of health systems to ensure continued operations for universal and equitable health services. Despite challenges and adversities, member states are increasingly adopting strategies championed by the WHO guidance for climate resilient and environmentally sustainable healthcare facilities. To scale up efforts, WHO is launching an updated global framework for climate resilient, sustainable, and low-carbon healthcare that offers a unique opportunity for our region to pioneer robust, sustainable health systems. The pandemic highlighted health systems fragilities. With the imminent challenge of climate change, urgent and scaled action is crucial. It is essential for us to transition and pivot from dialogue to tangible actions and impacts. I encourage Western Pacific member states to endorse the goal of climate resilient, low carbon health systems. Today's event will provide an important platform for deepening our understanding of climate resilient and sustainable health systems, fostering collaboration and knowledge exchange among member states, and stimulating the work across the region. I look forward to the accomplishments that will result from this event. Thank you very much, and back to you, Akim.
Thank you very much, Dr. Jacob. In fact, you've just set the tone for the objectives of today. We are specifically aiming to share global and regional developments from the work that has been done by the Secretariat and across member states. Have an opportunity to share experience, approaches, and the progress of work that I've done so far so we can learn from each other on how to transition to low carbon health systems. And it would also be a good opportunity to discuss and identify policy options that member states in the region can take away from our discussion today, but also build on the work we will do in the future. As you note from Dr. Jakob's opening remark, she is an ardent and important advocate and a committed advocate for this subject area. And we have colleagues in the Secretariat, Dr. Iromasa Okayasu and Dr. Mark Jacobs from the Pacific Health Systems, Pacific Technical Support Office, the South Pacific WR as well, covering many of the areas in the Pacific where this is an important subject area. Just before I open the floor to talk about the agenda for today, I would also like to introduce our distinguished speakers from our member states. And I'm really delighted that we have Dr. James Fong, the Permanent Secretary for the Ministry of Health and Medical Services from Fiji, joining us today as a speaker to share the experiences. Thank you, Dr. Fong. And we have Dr. Bukeo from Lao Democratic Republic. Thank you, Dr. Bukeo. He's the Deputy Director General for the Hygiene and Health Promotion Department. And I am really pleased that Dr. Norahati Rushli is also able to join us from Malaysia. She is the Deputy Director General for Health at the Ministry of Health in Malaysia. We would also use the opportunity to discuss with people around the room, and we have a few interventions online as well. Now, as I mentioned, this is an important area of work that cuts across the three levels of the Secretariat and a critical area for member states. I wouldn't be able to do justice to all the valiant efforts that's going on in the region. Luckily, we have a short video that will demonstrate the importance of this item and also how we work across the organization. This will come up shortly. But before then, I would also want to highlight that we are fortunate to have a presentation from our colleague from Geneva. Our Director of Environmental Health, Dr. Marianera, would also give us a video presentation to highlight the key WHO global agenda in this area and the work that we are doing. So if you could please kindly show the overview video for a minute. Thanks.
As the world faces the challenges of climate change, the role of health systems becomes more critical than ever. In order to combat the effects of climate change, many countries have committed to achieving climate resilient and sustainable low-carbon health systems promoted under the COP26 Health Program. However, more countries must follow their lead. The World Health Organization is supporting countries in the Western Pacific to strengthen health systems, making them more efficient and more responsive to the changing climate in order to provide communities with the highest quality of care. One tool to support countries is a WHO operational framework for building climate resilient and low-carbon health systems. It provides guidance on how the health sector can systematically and effectively address the challenges presented by climate change while reducing its own contribution to the crisis. The Alliance for Transformative Action on Climate and Health, or ATTACH, a WHO initiative, also supports member states to realize the ambitions under the COP26 Health Program. ATTACH works with countries to achieve their commitments through advocacy, technical support, knowledge sharing, monitoring, and access to finance. Under ATTACH, there are 5 thematic working groups to support participants to achieve their health commitments. the Climate Resilient Health Systems Working Group, the Low Carbon Sustainable Health Systems Working Group, the Supply Chains Working Group, the Financing the Health Commitments on Climate Resilient and Low Carbon Health Systems Working Group, and the Initiative on Climate Action and Nutrition. Through implementing the WHO operational framework for building climate resilient and low carbon health systems and signing up to attach, member states can deliver high quality care where and when it is needed most, reduce their health system's contribution to climate change, and save lives. Together, let's forge a path towards a greener, healthier future for everyone.
Thank you very much for that. A big thank you to teams across various parts of the region working on this area of work. Now, it's time to start in earnest the discussion for today. And I will be inviting Dr. Marianera to join us with the video presentation, giving an overview of the global perspective in this area and the work of the Secretariat globally that is informing what we do in the region and the work with member states. So if you please show the video from Dr. Marianera.
Excellencies, dear participants, dear colleagues, dear friends, and all supporters of climate change and health. Whenever you open a newspaper these days, the headlines will be talking about extreme weather events, we'll be talking about climate change, and we'll be talking about the damage we are doing to our nature, to our biodiversity, how we are polluting, and how we are very badly consuming, recycling, and making sure that we are not damaging our planet. And all of this is no doubt having a very negative impact in our health. You know what we said, that the climate crisis is a health crisis, whether it's through vector-borne diseases, infectious diseases in general, non-communicable diseases, extreme weather events, or heat waves, name it. Health is very, very much negatively affected. And that's why the health sector needs to respond. Many initiatives are in place now and many global strategic movements that we need to promote and engage on it. One is that, as you know, in order to protect our health systems that are now coping with the consequences of climate change, we need to make those health systems prepare, climate resilience, better prepared to cope with the consequences of climate change. We need to make them as well low carbon, and this is obviously only relevant for those medium and high income countries that are contributing to the carbon footprint. As you know, if we put together the global contribution to the carbon footprint, to the greenhouse gases emissions of the health sector, it will represent 5% of the global emissions. And therefore, as the health responsibles, we need to contribute to that reduction on the emissions. But we need as well to make sure that our countries have a good framework, an operational framework, knowing what is needed in order to make our health systems climate resilient, better prepared to cope with those consequences, better adapted. And for that, we are very happy that a new operational framework has been launched, and you will be discussing about that, hopefully implemented as well as country level. Attach, let me tell you that Attach is a platform, an incredible alliance for transformative action on climate change and health. We have many countries joining in, more than 75 at the moment. We need more countries from your region, from WIPRO, and we are inviting all of you to have a look at that and hopefully having you on board 100% as soon as possible. We need as well to make sure that at COP28 this year, you know that this is a critical year for the health community. For the first time ever, after many years of being present or promoting the health argument for more climate action, we will have a dedicated health day. And at Health Day, we want the ministries of health to be represented. We want to hear the voice of the health community telling the negotiators three messages. One, we need to hear what climate change is doing to our health and how devastating it is for the health community, putting at risk even many of the good advancements we had in the last years. The second thing, we want to make sure that our health systems will be the ones prepared to respond to the challenges of the 21st century. The third message is that by mitigating climate change, we can obtain enormous benefits for the health of the people, coming from healthy diets, coming from the reduction in the air pollution, which is killing 7 million people every year, and coming from a better urban planning and then reducing sedentary lifestyle and air pollution at the city level. I count on all of you to make sure that this health argument is very strongly represented. You convince your countries, you mobilize your communities wherever you are working. We need your voice. We need to endorse this attach. We need to endorse the operational framework. We need to hear very, very strongly the voice of the health community. This is the only way we will respond to the climate crisis with the ambition that is needed and at the speed that is needed, and it's not the case now. That's why we need all of you. Thank you so much for this opportunity. I'm sure that your discussions will be very, very successful, and I wish you the best, and please remain very much engaged on climate change and health.
Thank you to Dr. Maria Neira. She poses us a challenge. How do we rise up together, to work together to join the ATTACH program in the region to make our health systems low carbon as well as resilient to the impact of climate change and environment? We have many examples of ongoing work in the region, which we will share with you today. I'm really, really delighted that we have 3 member states in the room with us, and I'm sure the panelists from there would be able to give you some really exciting examples of the work that is going on. But many of you who are not in the speaking panel also have examples, which hopefully we will get a chance to hear about. I will start with Lao PDR, and I'm looking at Dr. Bukeo. Thank you so much for joining us today. Lao PDR is one of the first countries to sign up to the ATTACH program that Dr. Maria Neira was just talking about. And you've also put together the Health Adaptation Plan, which was signed off in 2023, just this year. Dr. Bukeo, if I may ask you to really highlight the priorities that are in the Health Adaptation Plan that you've put together and the approach that you're taking in Lao PDR, and particularly if you could share with us the efforts that is being taken to make the health system a lot more climate resilient than it is currently in Laos. Over to you.
Thank you, Chair. Good afternoon, ladies and gentlemen. From climate change, I would like to briefly presentation because we have the long time focus about the healthcare facility, because we have the program for the waste management and solid waste and hazardous waste program for the low carbon in Laos country. The first, I would like to present a climate change and health situation in Laos. Mostly north past mean annual rainfall now 13% increase. The north past flooding every year. The mostly climate change in the dry season is longer than the past, and flooding every year, mostly the landslide and flooding in the lowland areas in our country. Existing climate change and health strategy, the 9 National Social Economic Development Plan 2021 and 2025. The health sector strategy for improving adaptation capacity to Climate Change 2018 Health Specific National Adaptation Plan (SNAP) for long-term capacity building and reducing vulnerable to be developed. Current and further climate change leads to the health in the country. The mostly every year happen about the diarrhea disease and dengue fever very high. The second about the under nutrition because after flooding, agriculture loss. The second thing about third thing about waterborne disease. Many diseases happen every year. Diarrhea disease more than 11% increase this situation, and death of among children under 5 years is high risk in our country. Climate change for health strategy and SNAP. Lao MOA developed the strategy and climate change and health adaptation 2018-2020. SNAP include adaptation and mitigation action plan for the low carbon and sustainable healthcare, including under safe, clean, and clean, resilient for healthcare facility. Safe, clean, and clean climate resilient health care facility. MOA's committee to the promote low carbon and environmentally sustainable for healthcare facility in Laos. Clean and clean of the initiative. Mostly we have program about the clean air policy and collaboration with other agencies in our country, mostly the Malay. We have strengthening and the capacity for the people in the rural areas, mostly in the least in the lowland area. We have the communication and how can the strengthening capacity building for the local governor should be strengthening and should be information early warning system. Summary recommendation. SNAP important really for the assessment for the need. The mitigation action plan for the healthcare facility. And we have the safe, clean, and clean climate resilient for the healthcare facility. I mentioned before about we have the program, how about the disposal about the waste and wastewater, and including about hazardous waste. Mostly we focus about the need for the vaccination, how can the disposal and maintenance, operation maintenance very well. We have other program in the healthcare facility about the water, sanitation and hygiene. Focus about the low carbon and climate resilient infrastructure. Mostly in rural area, we have the program about the water supply in rural mountainous lack of the water, mostly in the dry season, not enough water. Healthcare facilities should be provide 24-hour water supply, very important, and including about quality of water for the use for the people and for the patients using in the healthcare facility. And we have the scaling this initiative every year. 2040 healthcare facility should be strengthening and capacitating for the people, for the nurse, doctor, how can the take care about the waste, solid waste, healthcare facility, and how can hygiene and water sanitation, including a hand washing facility. Listen, learn, and further direction. This really important because COP27 Prime Minister to commitment in Laos, we've been started about the healthcare facility, how can reduce low carbon in the country. Now we don't use a burning system. We use about autoclave and after the disposing when the finished disposing. The another activity we focus more infrastructure. Infrastructure not only to the building infrastructure about the water sanitation, about the operation maintenance very well in the healthcare facility, and other one we focus about the other project, for example, vaccination and mother child care and food and nutrition very well. This I would like to presentation. The last one, further director, we have the carbon emission assessment standard and implementation capacity. Co-health benefit assessment from the mitigation action strategy, risk communication for the community to the reduce open burning practice. Hypothesis driven approach develop continue scale up to the clean and green climate resilient for the healthcare facility. And reach the national and strategy target goal and the COP26 commitment. This I would like to some presentation for shortly for our country. Thank you very much for your kind attention. Thank you.
Thank you so much, Dr. Bukeo. What you've just highlighted is exactly why we need an operational framework that Dr. Maria Neira was mentioning earlier on, that brings the climate resilient work and the low carbon health system work together, because there are no areas of the health system that is untouched by the climate change and the environmental issues. And a good health system, a good health infrastructure that is sustainable, that looks at climate, works together, and supports our ambition to create a healthier system. So with that, and good luck with the plan and implementation, I will turn to Dr. Rushley from Malaysia. And in fact, Malaysia has been doing a lot of work in this area for several decades. And you started out with the environmental health plan that really looks at the health system as well as the environmental health threats, pulling all of this together. And I think it would be really helpful for you to highlight to us the progress that have been made over the years and the experiences that you've learned whilst you're implementing this plan. And particularly picking up from where Dr. Bukeo left off around climate sensitive health outcomes, including waterborne, foodborne, and wash-related diseases. If you could give us an highlight of Malaysia's experience and the opportunities to learn from your work so far. Thank you.
Thank you, sir. Can I have my slide? Next slide. Next, please. This is an outline of my presentation. Next slide. Okay, I would like to start with the on talking about the projection of climate scenario in Malaysia. Next slide, please. As we are aware that climate change as well as the environmental issues are the current priorities that we need to really give a constant effort in every agencies, and it needs coordination and the whole of government approach to handle, to be well prepared as well as to respond to any event, especially on extreme event. So Malaysia had actually projected the climate scenario in 2022 for 2100 projection, whereby based on that projection, we found that actually an average of annual surface temperature is expected to rise by 1.9 to 2.1%. Average annual surface temperature is expected to rise by 1.9 to 2.1%.
sea levels are projected to rise by about 0.7 meters. And following that climate projection, we do understand that the impact of this event, especially when it involves major events or extreme events, it will cause a major or big impact, such as more frequent and larger floods will happen, more frequent and more intense heavy rain, more intense tropical cyclones, storms on shore, more frequent very hot days or heat related issues, more frequent and longer droughts. So these are the things that I think what Malaysia needs to be well prepared, because we need to have one really coordinated system or mechanism where we can be well prepared and respond anytime when the events happen. Next slide. Just to share with you an extreme weather scenarios in Malaysia. For example, like a Great Flood 2014, and then we have a drought 2016, heat wave 2016, and water disruption 22, and we have many other major events happening around the year. Next slide. Okay, this is things that I would like to highlight here on the adaptation plan and vulnerability assessment. This is very important actually for every country to have their national adaptation plan and how we do the vulnerability assessment. So, next slide. In managing climate change, Malaysia has established the main climate change action council, what we call it as MyCAC. And this MyCAC is to address the policy direction of climate change. And the chair of this MyCAC will be the Honorable Prime Minister and the key cabinet ministers and state leaders as the members. And from this committee or council, any decision needs to be approval by the government, needs to be bring forward to the cabinet level, in which the cabinet is the highest policy decision making body in the country on climate change matters. So any decision need to be approved by the government. This committee will highlight or bring the and table up into during the cabinet meeting. And in what I would like to highlight here, in every level of this MyCAC, so you can see that Ministry of Health Malaysia is part of it, because it's very important that we need to be part of this council for us to be well prepared, and we are actually integrated with other agencies so that everything will be integrated in terms of preparedness as well as response. Next slide. In Malaysia, National Determined Contribution, or we call it as NDC, the target is to reduce the economy-wide carbon intensity against GDP of 45% in 2030, if we compare to 2005 level. There are 6 sectors of priority for adaptation. For example, like water resources, coastal resources, agriculture and food security, cities and infrastructure, public health and forestry, biodiversity. And as for public health sector, 2 areas of concern will be on prediction of climate sensitive diseases and enhancing the climate resilience healthcare facilities. Next slide. And Malaysia has identified the public health aspect on what are the priorities that we need to focus on in their adaptation efforts to climate change. So in view of the National Adaptation Plan, it will encompass the strengthening existing public health program. So as been listed there in the slides, we have 7 focus areas that we need to enhance or strengthen. One is on this dengue control program, malaria control program, management of public health on heat wave, on haze, on flood, national emergency program, and nutrition program. These are the 7 main focus areas will be in which we incorporated in the National Adaptation Plan, and whereby each
focus areas will be having a small group, subgroup discussion, group task force be given to them to look into detail in every single focus areas. Next slide. The other components that we like to highlight on the vulnerability assessment. This is very important because this assessment needs to be done regularly, and this is to assess the vulnerability to climate change based on the downscale climate change data. And we would like to use this vulnerability assessment of VA to identify the adaptation needs, the gaps, the constraints, and level of supports received for adaptation to climate change. And these are among the vulnerability assessment that's been carried out by Malaysia and in the pipeline, which are, for example, like healthcare facilities projection for sea level rise and risk flooding up to 2100, in which we have conducted for about 37 river basins. Second one on climate sensitive diseases, on food waterborne diseases, heat related morbidity study. The third one on vulnerability and adaptation assessment study in small islands, about 5 islands in Malaysia, in which is in progress, and assessment of resilient healthcare facilities, which is also in progress. And next slide. How well are we prepared for any type of this extreme events or any type of disasters or public emergencies in relation to climate change or in terms of events? So looking into the importance of one central coordination committee. So actually in Malaysia, we had one committee, we call it National Disaster Management Committee. And this National Disaster Management Committee is under Department of Prime Minister. And under this National Disaster Management Committee, will actually concern under the directive of National Security Council 20, whereby every single agencies need to be prepared for any type of disasters or public emergencies, including big event or extreme event related to weather or any environmental issues. So Ministry of Health Malaysia is part of this committee, and it starts from the at the operational level. We call it District Disaster Management Committee, in which it will be headed by the district officer. Well, at the state level, we have another Disaster Management Committee, in which the state government will be the chair of that committee, and National Disaster Management Committee at the national level, in which it will be chaired by the NAMA, or we call it the National Agency for Disaster Management Agency. Next slide. So very important, under this National Security Council directive, we have 6 major roles. Sorry, can you return back the previous slide? Before that, one more, before. Okay, on the right hand side, on the importance of the Ministry of Health role here, on the public health role in this National Security Council Directive 20, whereby here is indicated the 6 most important items there. One is on medical treatment, the role of medical treatment, public health services, especially on prevention, promotion and control before, during and after event. Emergency medical services, talking about the mobilization of municipal medical services as required, and public advisory on risk-com, and as well as the importance on mental health services, especially not only for the casualties, but also to the healthcare workers and all the response team. Next slide. These are examples that extreme weather event happening in Malaysia. For example, just to show you, there are 3 monsoon floods or extreme event happened in Malaysia. For example, in 27, we had one monsoon flood, big flood, involved 18 deaths, with involved 1.7 billion loss. Whereby in 2015, 2% of Malaysian population affected with 25 deaths, and cost about 2.9 billion. And the latest one in 2021 and 2022, 2.9% of Malaysian population affected with 61 deaths. It cost 6.1 billion loss. So in view of this scenario, we can see that increase in one is talking about the event itself, talking about the frequency of the event, talking about the loss that we have, especially on the death, the casualties death, as well as the cost that being affected during this event. Next slide. And to be well prepared, we have standard operating procedures and guidelines on floods and all types of extreme events. Next slide. For example, this one is for flood. We have next slide. For haste, next slide. We have heat wave as well, and all this actually as standard operating procedures and guidelines. Actually, it is an integrated guideline whereby it's integrated with other agencies. So all these guidelines talking about the preparedness, the response, even a post extreme event or any post disaster or public emergencies. Next slide. What's the way forward? So currently, Malaysia is in the process of developing a Malaysia National Adaptation Plan, what we call is MyNAP, where the pre-development is led by the Ministry of Natural Resources, Environmental and Climate Change, and the public health component is incorporated in MyNAP itself. And furthermore, to this MyNAP, we like to develop another to refining this for public health component, where we will have the national health national adaptation plan just for health component, and expanding the capacity building and training on vulnerability and adaptation assessment of health personnel in all levels, as well as enhancing the resiliency of healthcare facilities with periodic assessment of the healthcare facilities resident status. With that, thank you very much.
Thank you so much, Dr. Rushley. I know it's difficult to put decades of work into a few minutes, but what you've highlighted for us, building on Dr. Bukeo's core business importance of this, is the structured approach to doing this work, and why national commitment is necessary, why we need to work beyond the health sector and make sure that there is political commitment at the highest level. And you touched on the impact that this has on people, lives, and economy, which is exactly why it is an important area of work for us. So with that, I will turn to Fiji. And Dr. Fong, I know Fiji has done a lot of work on vulnerability assessment, looking at healthcare facilities that Dr. Rushley was just mentioning. It would be good if you could highlight to us the motivation for this area of work in Fiji and how you've gone about creating the momentum from the COP26 commitments and as you prepare for COP28. And in particular, if you could highlight how Fiji is working beyond the health sector with energy, transport, and other areas to make this a reality in your country. Thank you, Dr. Fong.
Thank you, Chair. Next slide, please. Thank you. The impact of climate change and health on our small Pacific Island countries have been well articulated throughout the day-to-day. So I'll just go straight into what we've been doing. The Ministry of Health and Medical Services partners has been partnering with a number of agencies and development partners in doing climate change and health work since 2011. We are prepared to initiate some transformative strategies to build resilience to the impacts of climate change and also to reduce carbon emission. However, we do realize that we can't do it alone. And we have been also working with our other Pacific Island countries to follow us in making the same commitments that we are doing. We also understand that this initiative will open doors for new partners to come on board and to strengthen the resolve for better coordination within the region. Health sector contributes about 5% of greenhouse gas emissions worldwide, and we can make a difference if we start acting now, supporting the goal of the Paris Agreement Next slide, please. Next slide, please. Please. Based on our COP26 commitments, we know that there are three bigger areas. That is the climate resilient health system, the sustainable low carbon health system, and securing funding for climate change and health works. With regards to climate resilient health system, we've done the two major activities, which is climate change and health vulnerability assessment. And we are using the data assessment reports to update our national adaptation plan. We're also using the sustainable low carbon health system to incorporate actions that contribute to the reduction of greenhouse gas emission by the health sector. And we have a plan to ensure that we have the plan published by June 2024 with the objective of meeting the zero net health sector emission by 2050. And finally, we are looking at using both the assessment report and the National Health Adaptation Plan to secure funding for climate change and health works. Fiji had progressed in all the three areas targeted under the COP26 commitment. We did vulnerability assessment from 2021 to 2022. We assessed about 211 health care facilities. And we are currently implementing intervention strategies with the support of partners like WHO, COICA, and JICA. We also have proposals under development and under consideration with other donor partners. We will be moving into assessment of vulnerable communities in 2024. Based on the assessment reports, we have also updated our climate change and health strategic action plan. And we will be launching the new Health National Adaptation Plan 2023 to 2030 by December the 1st. This new plan will have three main phases. The establishment phase, which was actually the phase that we had carried out during 2016-2022 adaptation plan. And it focused mostly on strengthening our surveillance of climate-sensitive diseases and awareness of climate change and health impacts. Then we are ready to move into the enhancement phase, where we approach the mainstreaming of climate actions across all health sector programs, focusing on climate-sensitive health outcomes and not just the diseases. In the latter part of this 2023 to 2030 plan, we will then be looking at climate resilient health system through international best practices in the face of climate change and reduction in greenhouse gas emissions. So that's with the first of the commitments. In the second commitment, next slide. Oh, next one. Thank you. We have actually started our multi-stakeholder consultations with the first meeting of ministers and high-level officials. We aim that to get an action plan published by June 2024. And the objective, of course, is to reach net zero health sector emissions by 2050. And that's all part of the HDAP and multi-sector stakeholder consultation. We finally, next slide. So basically, this is the political statement that we are all signing on also. And basically, we're saying that we encourage WPRO members to support and sign into this COP28 Declaration on Climate and Health. As outlined in this slide, the declaration is meant to be a political call to action, which outlines a set of common priorities. It is informed by attached commitments, and the attached secretariat is keen to ensure that attached is used as the platform and mechanism to take this momentum forward, and also to monitor progress beyond COP28. Thank you.
Thank you very much, Dr. Fong. You've just brought home the conversation we've been having so far. A political commitment at the highest level, national commitment across sectors, looking beyond the health sector itself to gain action, and also working beyond national boundaries with friends, with neighbors, to make sure that the action is impactful and powerful as part of a global commitment. and you recognize the need for additional resources to do this, but do it as part of core business. I think those are very important points that you've raised. Thank you. We are running short of time, but I think we have one or two interventions from the floor that we will take. Looking particularly online, we have intervention from the Republic of Korea, and we will take that. And I look around the room for the opportunity to take one or two interventions before we close at 13:50. So we have about 6-7 minutes. I'll go to Dr. Sheen, Professor Sheen.
Yes. Okay. Thank you, Chair. Thank you. It's my great pleasure to introduce what has been done in Korea for the Green Hospital. The Yonsei University Health System in Seoul, where I am working, started to implement Green Hospital system over 10 years and have led Green Hospital activities in Korea since then. From 2013, Korea government, Ministry of Environment, and Korea Environmental Industrial Technology Institute designated about 40 hospitals during a couple of years, and this program continued for more years until 2017. And another remarkable event was the creation of Korea Society for Green Hospital, with hospitals, academias, and experts in energy, in indoor air management, chemistry and toxicology, and so on. We had inauguration in June 2013 with support from Global Green Hospital Network, which is also related to Healthcare Without Harm, which is prominent NGO for the green hospital and healthcare decarbonization. Korea Society for Green Hospital held an Asian network meeting in 2016 with active participation from Philippines, Taiwan, and Singapore, and Indonesia, and so on. In our hospital, Yonsei University Health System has strategies for Green Hospital for 5 areas. First, establishment of TFT, comprising each relevant sector for leadership. Leadership and commitment is mostly important for the initiation and continuation of these activities. And second, we install building energy management system based on IT system, and we always feed back to the workers in my hospitals. And third, eliminate all mercury-containing medical devices and minimize other toxic chemicals in the hospital. And also, we introduce green purchasing guidelines. And lastly, we have adequate water and waste treatment and reuse, recycling system. We achieved a lot in energy field. We achieved cost containment over $3 billion compared to business as usual from 2011 to 2013 for about 3 years. And energy use is maintained well below the governmental cap in spite of increase of new huge buildings such as Cancer Center and Research Center. So if we invest initially some budget for the installation of mechanics for energy reduction with active campaign, we proved we could get good cost-benefit ratio. And also we eliminate mercury type blood pressure measurement devices and replace all wristband in patients, for inpatient, with non-toxic ones. Also, we have good water treatment and recycling system. So also we can save supply cost for water approximately $160,000 in a year. So we have been done in my hospital and also in our governmental support and governmental activities as well. But governmental activities not continuing now. However, few hospitals are also interested in maintaining Korean hospital programs. However, challenges are we still have low level of understanding among healthcare workers. So we need more promotion and sharing information on this. So Korean hospital activities remains still in several hospitals. However, recently, ESG program is concerned by the government and companies in Korea. So we can expect hospitals could involved in this movement and in this system framework in the near future. That's my intervention. Thank you very much.
Thank you very much, Professor Shin. You've just highlighted why this makes sense. Economic savings, practicality, safety, and all of that actually involve getting a climate resilient health system that can also be low carbon. You've highlighted how this is important in high income setting and how providers can actually make this a big part of their business and promote climate resilient and low carbon health systems. We have just 2 minutes left before we finish this session. It's been a fantastic opportunity to hear from Korea, from Malaysia, from Fiji, and from Laos. I just wanted to give 1 minute to my colleagues from the Secretariat who have also been working on this in supporting member states. And from the Pacific, Dr. Mark Jacobs.
Thanks very much, Akeem, and thanks everybody for participating. I think there's a lot of interest, of course, as there should be in this issue, and I think we could keep on talking all afternoon quite happily and quite productively, but we don't have that luxury. I'll just make a couple of very quick comments. One is, personally for me, it's been very exciting being in here because we've heard from the country I currently have the honour of working in. We've heard from the country that until 2 years ago I had the honour of working in. And we've heard from the country when 30 years ago, when I was a very young professional, just starting off in public health and environmental health. And I got funded to go on an international study tour. And I asked the leaders in Australia where I should visit. First places they suggested, first places I went was Malaysia. And so obviously there's been a lot of active work in Malaysia for a long time now. So it's been my privilege. We've heard about health system resilience. The one thing I'll say about resilience is, of course, health systems that are resilient to climate change are resilient to other challenges also. So there's many reasons to focus on that. We've heard about mitigation. And the one thing I'd say about mitigation is, of course, for the health sector to influence the action of other sectors, we need to be walking the talk. And so mitigation, reducing our own carbon footprint, can't be an afterthought. It needs to be front and centre, and we've heard about that. The one thing we haven't heard about today that I think is also important, but it wasn't in scope, so it's okay we didn't hear about it, is the issue of health co-benefits. And being very clear that we talk about that the efforts of society more broadly in other sectors to reduce their own carbon footprint actually produce health benefits as well. And that's important for us to mention because it increases the case for investing in those efforts in the other sectors. So it's in the interests of the other sectors to understand that what they are wanting to do to tackle climate change also benefits health. So it's a win-win. And so it makes it easier for those other sectors to also get commitment to invest in this. So I think we need to keep on focusing on that too. Anyway, thank you.
Thank you very much, Mark. And you're right, we want to discuss this and keep going. But now we do have to close, but set an agenda for forward action and forward look into this area of work. And informally, we can continue conversation about this until we come to the next RC. So I'll ask my colleague, Dr. Okayasu, to ring us off with closing remarks on how we go forward. Thanks.
Thank you very much. Thank you very much, Chair. As the acting DN and other participants indicated, the climate change isn't just an environmental crisis, but a health emergency. Health sector contributes 5 to 10% of global greenhouse gas emissions. Therefore, it is imperative to reduce the carbon footprint of the health sector. but without compromising on quality and access to healthcare. Today's discussion, especially case studies across the region, reminded us that climate resilient, low carbon health systems are achievable. And it is also potentially healthier, safer, and more cost effective with better water sanitation and hygiene, less waste, and then more energy efficient. WHO is committed to collaborating with member states and partners such as ATASH to accelerate policies and action in our regions, promoting and realizing low carbon resilient health systems. Again, I appreciate our sincere thanks to all our participants today. Thank you very much.
Thank you very much, and goodbye for now. We will continue the discussion offline.
Thank
Yeah.
Thank you.
Okay, welcome back. Before we move to the consideration of resolutions, I would like to use my discretion as chairperson to return briefly to agenda item 16, coordination of the work of the World Health Assembly, the Executive Board, and the Regional Committee, particularly item 16.7, other items. I understand that New Zealand would like to make an intervention on this item. New Zealand, the floor is yours.
Thank you, Madam Chair, and thank you for allowing me to intervene on the issue of the Western Pacific region's next two representatives to the WHO Executive Board. The private informal consultation caucus last evening supported the nomination of Brunei Darussalam, but was unable to resolve the remaining seats between the nominations of New Zealand and the Republic of Korea. Aotearoa New Zealand maintains the position that all member states should be afforded equal status, regardless of size or income, and that we need to ensure our procedures and conventions allow space for all of us to serve our region in the various representative roles available to us. However, in the interests of consensus, New Zealand is prepared to stand aside for the Republic of Korea to serve, alongside Brunei Darussalam as representatives of the Western Pacific region on the Executive Board for the 2024 to 2027 term. Acknowledging that this situation is likely to recur and that there are important elements of principle that need clarification, we are pleased to co-sponsor the following decision with our friends from the Republic of Korea for consideration of the committee. The Regional Committee, noting that member states' deliberations at a private informal consultation, caucus, on the nominations from the Western Pacific region for the available Executive Board seats for the 2024 to 2027 period did not achieve consensus, and noting the informal proposal by the former Regional Director in October 2019, developed in consultation with member states, which proposed a formula to guide the allocation of the 5 Executive Board seats allocated to the Western Pacific region as follows. 1 of the region's seats should be held by a Pacific Island country. At any given time, 1 to 2 seats should be held by ASEAN countries, and the remaining seats are to be shared by the other countries in the region, noting the need for a balance between high and middle income countries. Considering that there is a need to achieve greater clarity and certainty for member states regarding the distribution of Executive Board seats within the diverse Western Pacific region, decided to request the Regional Director to prepare options for the equitable distribution of Executive Board seats allocated to the Western Pacific region, taking account of the formula proposed by the former Regional Director in consultation with member states in October 2019, geographical distribution, equitable rotational representation amongst middle and high income countries, and good practice examples from other WHO regions and/or other UN organizations, to consult with member states of the Western Pacific region prior to RCM 75 on these options, and under the item on the coordination of the work of the World Health Assembly, the Executive Board, and the Regional Committee for the 75th RCM, include a proposal on the equitable distribution of Executive Board seats allocated to the Western Pacific region for decision by the Regional Committee in 2024. Thank you.
Thank you, New Zealand. Would any other member states like to take the floor on this issue? Republic of Korea, followed by I call on the distinguished representative of Republic of Korea, followed by China.
Thank you, Chair. Dr. Jacob. Dear colleagues, it is my great pleasure to inform you that on the matter left undecided yesterday at the informal caucus, New Zealand and Korea held a bilateral meeting and came to this understanding as explained by New Zealand in the spirit of compromise and unity of this House. I would like to thank my New Zealand colleague for his productive and constructive proposal that opens a possible way forward that we can support fully. We would hope for your support to this proposal that we have agreed. Thank you.
Thank you. Now, I call on the representative of China to be followed by Brunei Darussalam.
Thank you, Chair. Firstly, I was not aware, China is not aware of this discussion at the beginning of today's session, because according to last caucus meeting, we agreed that this discussion will be had during the coffee break in the afternoon. And I sort of a bit of caught up by this because we were still discussing with the capital on this. As I deliberated at last private meeting of caucus meeting yesterday, we support Korea's resumption of the membership to resume when Japan's membership of executive board member will expire next year. And I'm sorry that when I read this text this morning, and I checked with my colleague who was attending the 2019 ASEM meeting here, I got to know that there was no such sort of informal proposal by the formal RD, which was discussed in public or agreed by all the member states. I understand that it was discussed privately with some member states. There might be some consensus, but it's not consensus among all the member states, or it's not in the written form language of these rules or of this formula. This is my first point. The second one is we support transparency of the allocation or appointment of executive membership in Wipro. And as we see that the 1 seat for Pacific region and 1 or 2 seats for the ASEAN region, this is a very good example of our transparency in the allocation of executive board membership. And we are very glad to see that there are more member states who are willing to contribute in global health and to engage in WHO affairs. But we really want to defend to the utmost the consensus regional approach and the long cherished and followed tradition of solidarity of our region, and as well as duly recognizing the significant contribution of the North Asian countries, especially in the past decade, not only to HQ and to this region of WHO. And also in taking into consideration the next few years before 2030, in the context of sustained financing, while there will be huge increase of assessed contribution from China at least. And also the third point I would like to clarify with all my dear member states and the secretariat is that I really feel sorry because there is not enough time for me to discuss internally with our capital. And we don't think it's the right time to make a decision on this process on how to go forward for the membership of the executive board membership for this region. At least we don't think this can be decided today or tomorrow during this ASEM because this is an abrupt issue. And because this cannot be cleared or decided in capital within a few hours or less than 2 days. And the fourth one is I do think that the role of the RD and the secretariat should take into a more significant role. And I believe that we should give more time and room for the RD elects and the secretariat to have more communication with the member states on this important topic, because everyone wants to contribute, and we don't want this competition turn into, results that we don't want to see. And we should have more room for the RD elects to have time with member states on this topic and to decide on the next steps for all the member states when they have taken the clear decisions from their capital. And my point is, we believe that the long tradition of gentleman's golden rule and the pre-caucus coordination and consensus reaching is the best option so far.
That's why we firmly support Korea's membership application. And we really want to have a united, a better WIPRO. We don't want to see the competition every year or every 2 years or every 3 years on this. I agree that we cannot agree on this resolution or any form of written formula or decision for next steps so far today. And we really want to see an enhanced role, enhancement of the leading role of regional director and the secretariat to have more diplomatic in advance consultation in activities to enhance the efficiency of private meetings. Thank you so much. Thank you, distinguished representative of China. Now I'd like to call on representative of Brunei Darussalam to be followed by Australia.
Good afternoon. So first of all, we thank member states for the support and trust given to Brunei Darussalam to take the next seat on the executive board. Brunei Darussalam agrees that the current formula is incomplete and therefore supports the suggestion to review it. We suggest that a consideration is given to set a minimum number of years since leaving the executive board as soon as a possible condition for countries to reapply to become an EB member in the future. Thank you.
Thank you, distinguished representative of Brunei. Now I would like to call on the representative of Australia.
Thank you very much, Chair. And I'd like to first, excuse me, thank our colleagues from New Zealand for their willingness to serve on the executive board and their flexibility in this case to enable consensus to be reached on this important matter. We congratulate the Republic of Korea and Brunei. We look forward to working with them as our executive board representatives in the future. And we're pleased that it was possible following yesterday's discussions to reach an agreement. We very much welcome the proposal from the Republic of Korea and New Zealand to examine this issue further. I think the discussion yesterday, as well as the points that have been raised this afternoon, demonstrate that there does remain a lack of clarity in our arrangements for selecting nominations for the executive board in this region. And there clearly is a gap. We do not have the same understanding. We do not have documentation of what the understanding is amongst our membership. And we can see the possibility that there will be future difficulties at these meetings because of this lack of clarity. So we think the proposal from Republic of Korea and New Zealand to request the incoming regional director to further consult with the membership on these issues and to explore lessons and practice from other WHO regions is a good step forward and provides sufficient time over the next 12 months to fully explore the issues and consider what might be a constructive way forward. So we thank you very much for this proposal and we support it. Thanks.
Thank you, distinguished representative of Australia. Are there any further comments from member states? If there are no further comments, I would like to turn to the Secretariat. Dr. Jakob, please. Sorry. Oh, sorry. I would like to call on distinguished representative of Singapore.
Thank you, Chair. First, we'd like to express our appreciation to New Zealand and the Republic of Korea colleagues for coming to a consensus and a decision to move forward. I think is very important. I think we've all held this congenial atmosphere at our regional meetings, and it's good that we continue in that light. I also like to echo my colleague Australia's comments that I think for clarity for everyone, it would be good for us to have a common understanding of how we would handle these issues moving forward. We have encountered the similar issues in the past, and very likely we will encounter similar issues in the future. So for everyone's clarity, we do welcome this resolution put forward by New Zealand and Republic of Korea. Thank you.
Thank you, distinguished representative of Singapore. Now I'd like to call on the representative of Mongolia.
Thank you, Madam Chair. Mongolia would like to iterate our support for the endorsement of the proposed draft resolution to avoid further unnecessary prolonged discussions and disagreements. We don't really want to see any divisions concerning this matter. Thank you.
Thank you. Any other member states wishing to speak? I see none. I would like to give the floor to Dr. Jakob.
Thank you very much, Madam Chair. And first of all, let me express our thanks for the graciousness of New Zealand to withdraw its candidature for this year in the spirit of consensus. That is very much appreciated because it will facilitate business in moving forward. And at the same time, I would like to congratulate to Brunei Darussalam and also the Republic of Korea on the new membership at the executive board, and looking forward to working with all of you. During the last couple of weeks, we have invested an incredible amount of time to try to solve this problem and to try to find a consensus behind the scenes so that we can save time here in the regional committee. But we did not manage to. And the main reason behind this is that there is no clarity in the principles, and there is no clear formula that would serve the consensus building approach in this region. And the formula that we have goes back to 2019, as in 2018, there was a similar situation, and Dr. Kasai started to develop a formula. And I know informally that he also planned to further develop this formula to make it even better to serve the needs of the region. So last night, when we had the caucus meeting here, we all agreed with the participants in the meeting that what we have now is not good enough, and we need to continue the work on this. And we have even turned to the regional director-elect, asking him that he puts it on his list of to-do list of the many items that he has to take forward. And we agreed that this will go ahead. And I still believe that in the spirit of consensus of the regional committee, in the spirit of good geographical distribution, in the spirit of the fair allocation of the seats, of the 5 seats of the executive board in the regional committee, we have to do much more work. We have to consult each and every one of you and to come up with a formula or with some options for the regional committee next year. And this would be one of the tasks that the regional director would do. And that was the agreement of our caucus meeting last night. So this work has to go ahead. Whether we have a formal decision on this or an informal decision, but we need to go ahead with this because we cannot spend so much time every year behind the scene. And I really appreciate all the input that Dr. Kim put into this, all the input that I had with the colleagues from New Zealand, and yet we could not come to an agreement because our principles are not clear on this. So we have to work on this further. And I very strongly ask and encourage the regional committee to give a go-ahead to this and ask the new regional director to work with each and every one of you and bring some solutions or at least some options for the discussion next year. And in my previous role as a regional director for Europe, we had many times similar situations. And then we really sat down with all the member states and we found the formula that serves the region. And that is also a complicated region with 53 member states, but we managed to find a good formula, and I'm sure that we can do the same also for this region. So that's all from me. My plea, please let us give the mandate to the new RD to work on this. Thank you.
Thank you. With your kind permission, I would like to ask for a brief pause to confer with the Secretariat. I would like to kindly ask for 2 minutes. I would like to ask for 2 more minutes, please. distinguished representatives. We will suspend this issue for now, and we'll come back to it later. I propose to move on with agenda item consideration of proposed resolutions. We will now move on to the consideration of resolutions, and the first proposed resolution is resolution number WPR/RC 74/conference paper number 1 is on health security. May I call on the English rapporteur to read the resolution with amendments from the draft uploaded in the web portal, please?
Thank you, Madam Chair. I am pleased to present the draft resolution on health security. The resolution already includes any amendments suggested. In addition, the French rapporteur and I have tried to reflect any concerns expressed by member states, both in the plenary session and online, in the draft resolution. Now, I will read the resolution. Health security. The Regional Committee, recalling member state commitments to the Sustainable Development Goals, including to strengthen the capacity of all countries for early warning, risk reduction and management of national and global health risks, the WHO 13th General Program of Work 2019 to 2025, global target of 1 billion more people better protected from health emergencies by 2025, and the health security thematic priority in the Western Pacific vision for the future towards the healthiest and safest region. Recalling also World Health Assembly resolutions during the COVID-19 response in 2020, requesting that the WHO strengthen capacities at all levels to perform its functions under the International Health Regulations 2005, WHA 73.1. In 2021, on strengthening WHO preparedness for and response to health emergencies to support governments in their efforts to prepare for and respond to health emergencies, WHA 74.7. In 2022, on strengthening health emergency preparedness and response in urban settings, WHA 75.7, and in 2022, on strengthening clinical trials to provide evidence and improve research quality and coordination, WHA 70.8, recognizing the threat of widening inequities due to public health emergencies and the subsequent importance of health security strengthening in enabling and driving sustainable development for all, noting the complex mix of social, economic, and environmental challenges faced by Pacific Island countries and areas, and their consequently greater vulnerability to the impacts of public health emergencies, affirming the value of strategic investments in health security made in the region over nearly 2 decades, guided by the Asia-Pacific Strategy for Emerging Diseases and Public Health Emergencies, and the collective experiences of countries and areas in responding to public health emergencies, stressing the need for more comprehensive, integrated, multi-hazard, and multi-sectoral approaches to health security and for capacity development at national and subnational levels. 1. Endorses the Asia-Pacific Health Security Action Framework. 2. Urges member states, 1. to use the framework as a guide to develop or adapt national action plans for health security or similar strategies and policies according to local situations, capacities, and resources. 2, to foster high-level commitment and multi-sectoral collaboration among government agencies, as well as community and civil society organizations in support of a coordinated approach at national and subnational levels. 3, to ensure Adequate and sustainable resources are dedicated to strengthening health security capacities and meeting obligations under the International Health Regulations 2005 and future amendments. 3, request the regional director, 1, to provide technical support for member states to develop and implement national and subnational strategies and plans in line with the framework. 2, to facilitate advocacy and collaboration among member states, partners, and other stakeholders to strengthen health security capacities. 3, to report periodically on progress in the implementation of the Asia Pacific Health Security Action Framework. Thank you, Madam Chair.
Thank you. Are there any other proposed amendments? Please indicate your wish to speak by clicking the big button on your microphone. If none, the draft resolution is adopted. Now we will resume our consideration of agenda item 13, communication for health, document number WPR/RC 74/13.7. I would like to call. Okay. I would like to call on distinguished representative of Japan to be followed by Papua New Guinea.
Thank you, Madam Chair. Communication is essential and important for public health. In today's world, where we have easy access to a variety of information, it is also very important to strengthen communication to access the correct information and to take actions which leads to health. The creation of a regional action framework for communication for health is groundbreaking, and we are grateful to the Secretariat for drafting it. As part of our efforts to communicate for health in Japan, we are encouraging people to undergo medical checkups and promoting health through the use of various channels such as SNS. In particular, with regard to cancer screening, we are working to improve the rate of cancer screening using net theory and other methods. We have also created a handbook of measures to improve the rate of cancer screening, which compiles good practices from various local governments. We recognize that communication will become increasingly important in health promotion in the future, and we would like to implement health promotion that uses a communication approach for each event more in Japan, and use the communication approach to address various public health issues. I thank you.
Thank you. I would like to call on the representative of Papua New Guinea to be followed by Palau.
Thank you, Madam Chair, Regional Director, ladies and gentlemen. Papua New Guinea acknowledges the support of WHO for its ongoing assistance provided to PNG through the health sector in development of policies, programs, technical support on key priority areas to achieve public health goals, including the visions for healthy and prosperous nation where health and well-being is enjoyed by all in the country. In Western Pacific region, the WHO or WR has developed the communication strategy for health as set of principles and practices to help ensure communication interventions are strategic, evidence-based, and designed to inform and change attitudes and behaviors in ways that support the achievement of improved public health outcomes. The Communication for Health strategy supports our new national health plan, the health promotion and ICT policies, the immunization country strategies in the country. This includes the development of new health promotion and communication materials, products and approaches to revisiting best practices, materials and actions for disease control and healthy behaviors and practices in our communities, which we have already started with our mass media, local newspapers, social platforms like Facebook, WhatsApp, and other platforms to disseminate promotion messages. As to the integration of communication for health strategy, a number of key communication advocacy and social mobilization activities are being designed, tested, and implemented to address health issues that continue to rise in the communities in an effort to prevent disease outbreaks of communicable, non-communicable diseases, maternal and child health challenges amongst our 12 million people of the country. A crucial part of communication for health strategy will be to inform and educate our frontline health workers and general public through a wide range of strategic communication mediums and platforms to address health information and misinformation. PNG health motto is health is everyone's business and leaving no one behind, as it is stipulated in key result area 1 and 2 of the National Plan 21-2030 to transfer ownership of health back to the people through active health and community participation at a time when health sector in the country is challenged with workforce issues, medical supplies, health infrastructure deficiencies, and increasing population growth. PNG at this juncture express our appreciation to WHO and fully supports the draft regional action framework on communication for health. I thank you, Chair.
Thank you. I call on the distinguished representative of Palau to be followed by the Republic of Korea.
Honorable Chairperson, honorable ministers, esteemed colleagues, ladies and gentlemen, good afternoon. Palau appreciates the opportunity to examine communication for health, which we believe is a critical yet under-focused and under-invested component of public health systems. The success we had in Palau with our COVID-19 response would not have been achieved without consistent, timely, accurate, and credible risk communication and community engagement. We could not have achieved our high COVID-19 vaccination rates nor successfully implement preventive and mitigation measures if we did not invest in both time and financial resources towards health communication activities. Furthermore, through our pandemic experience, we learned of both the benefits and dangers of the use of social media during pandemics and other times of hardship and uncertainty. While we are able to reach population previously unreachable by utilizing social media platforms, we also faced an unprecedented volume and impact of web-based misinformation and disdain. We see this as a key issue that needs to be addressed in our region, and we appreciate the C4H strategies outlined in the proposed Regional Action Framework on Communication for Health, which we believe would not only assist us with addressing issues, but would also allow for stronger health messaging efforts and foster more trust, cooperation, and collaboration with our communities. With this, Palau endorses the proposed Regional Action Framework on Communication for Health and encourages all priorities and incorporates strategic health communication as a required component of all program planning and implementation activities. Thank you, Chairperson.
Thank you. I call on the distinguished representative of the Republic of Korea to be followed by Kiribati.
Thank you, Chair, Acting Aldi, distinguished ministers, delegates, ladies and gentlemen. The Republic of Korea expresses our gratitude to the WIPRO Secretariat for your hard work to develop communication for health approach and your support for each member states in securing skills and capacities to implement it. The RK fully supports the idea that communication for health is essential in achieving the goal of promoting health. Recognizing the importance of strategic communication in implementing various health promotion policies that include responses to COVID-19, drinking, smoking, and vaping, we have conducted regular press briefings or campaigns through the media. We note that WHO has selected 1. Good governance, 2. Health city, 3. Health information literacy as the 3 axes for promoting health and pursuing sustainable development. In line with this global trend, the RK has newly included a policy related to enhancing health equity by improving health information literacy in the sixth discipline of Health Plan 2030, building health-friendly environment. To be specific, the central government and local governments of Korea are conducting projects that involve periodic monitoring on health information literacy, providing verified health information through a verified platform, establishing an education system for utilizing health information, enhancing health information literacy of the vulnerable population, including the elderly and multicultural families. The Republic of Korea will contribute to the WIPRO's effort by checking if each actor of the above-mentioned projects is using a proper communication strategy and is equipped with the capacity for communication, referring to the 6 principles and 6 stages which are specified in Regional Action Framework on Communication for Health. If necessary, the RK will share its experiences and know-how from this process with the member countries that need skills and capacities for health communication. I thank you.
Thank you. Now I call on distinguished representative of Kiribati.
Madam Chair, Acting Regional Director, Honorable Ministers and Delegates, ladies and gentlemen, thank you for this opportunity to contribute to the discussion on this matter of utmost importance, especially in this digital era where information and misinformation spreads like wildfire. Indeed, the digital era can be seen as a double-edged sword when it comes to health and behavior change. While it brings numerous health benefits and efficiencies, it also presents challenges that we should be prepared for. And in my small island country, we are at the health sector find ourselves outpaced and struggling to keep up with the adverse impact of inline negativity and misinformation. Ladies and gentlemen, internet connectivity plays a key role in the spread of misinformation, misleading individuals into making harmful choices, such as rejecting established medical advice, engaging in risk-inherent behaviors. In Kiribati, we currently don't have fast internet, and whilst efforts are being made to introduce fast internet through submarine cables to our main island, we have a window of opportunity to strengthen our capacity for strategic health communication to address the impending risk of rapid and more widespread infodemic of misinformation and disinformation that will come packaged with the fast internet access. This is important as the gap between what people should do to protect their health and what they actually do will widen if there's inaction in this space by the health sector. Ladies and gentlemen, with limited media options, apart from social media, cost of effective communication for health in Kiribati can be expensive to do well. As a small country, we have health workers playing multiple roles, and our health promotion staffs are the key ones tasked with employing various communication strategies. These same health promotion staff will be the ones playing an important role in the implementation of this Communication for Health Action Framework. We are happy to learn of WHO's plan to invest in more communication for health technical staff in its country offices, and we fully support the next steps listed in the framework. Ladies and gentlemen, Kiribati endorses the important regional action framework on communication for health, and we look forward to working with WHO and partners to implement it at country level. Kamdaba, and thank you.
Thank you. Are there any more member state representatives who wish to speak on this topic? If not, I understand that there are representatives of non-state actors who wish to make a statement to the committee on this agenda item. Both written and oral statements will be uploaded to the designated RCM webpage and the meeting application. As statements reflect solely the views of the NGOs concerned, it follows that statements do not necessarily reflect the views of the World Health Organization, including its member states and secretariat. It is my pleasure to ask the NCD Alliance, together with the International Alliance of Patients Organizations, to deliver a short constituency statement to the regional committee. This will be followed by a statement from the representative of the International Pharmaceutical Students Federation.
Thank you, Madam Chair. To the member states, distinguished guests and ministers, the NCD Alliance or NCDA and the International Association of Patient Organizations or IAPO, together with Healthy Philippines Alliance, applaud the draft Regional Action Framework on Communication for Health for recognizing communications as an essential component of public health, not only during an emergency health situation, but also in the development and implementation of public health programs. However, the document could be more action-oriented by including time-bound targets to ensure the implementation of the framework. Therefore, to guarantee that communication for health will be integrated and sustained in public health interventions in the Western Pacific region, we urge member states to officially endorse the framework considering the following recommendations. 1. Consistent with the principle of no one left behind, the framework needs to include the right to accessible and accurate health information through adequate platforms at all times for all, including the most marginalized groups such as indigenous people, internally displaced people, persons living with disabilities or health conditions, and those with diverse gender identities. Second, public health messaging should equip individuals with the knowledge for them to make their own decisions and take action to protect their health. Each health risk is different, so tailored approaches are needed to communicate different risks. Communicators need to understand that people who are not aware of their health risks are not likely to act on them after simply hearing recommendations to reduce risk. It is important to increase awareness about the risks themselves so that people can understand. Third, member states need to invest in community-driven public health communications to rebuild the public's trust and counter misinformation propagated through both traditional and social media. Member states should encourage social participation through the meaningful involvement of communities, including patient organizations and people living with NCDs, in the production of public health messaging in emergency and non-emergency situations. And lastly, the framework needs to include a time-bound set of indicators to promote good governance and effective implementation through transparency and accountability mechanisms. Thank you for listening.
Honorable Chair, distinguished delegates, it is a great honor to speak on behalf of the International Pharmaceutical Students Federation, IPSF, which represents over 500,000 pharmaceutical students and recent graduates from over 100 countries worldwide. In an era where dissemination of health misinformation and disinformation presents formidable challenges to effective health communication, IPSF underscores the critical significance of strategic health communication. Therefore, IPSF commends both WHO and its member states for their efforts in advancing public health through the application of evidence-based health information via the Communication for Health C4H approach. Recognizing the efforts made to integrate C4H into health initiatives, we firmly assert that pharmacists, as the most accessible healthcare workers, play a pivotal role as key agents of accurate and reliable health communication. Leveraging their competencies and trainings, pharmacists are uniquely positioned to disseminate credible health information to the public. The IPSF Asia Pacific Regional Office, IPSF APRO, remains strongly committed to furnishing both pharmacists and the general public with evidence-based communication and information on specific health advocacies. During World No Tobacco Day this year, IPSF APRO published infographics on health implications of tobacco use. This campaign reached 1,520 social media users, offering insights on smoking statistics and health implications via informative infographics for the public. Additionally, IPSF APRO promoted the role of pharmacists in cancer care during the World Cancer Awareness Celebration. This has educated 1,466 social media users on the treatment options pharmacists provide. IPSF urges all relevant stakeholders to support the integral role of pharmacists as essential contributors to health communication. To reinforce the efficacy of health communication initiatives, member states need to proactively seek technical expertise from pharmacists in enhancing the framework of C4H. Lastly, IPSF encourages all member states to implement policies aimed at eradicating health disinformation, including strengthening protocols for evidence-based and dependable information dissemination. Thank you for your kind attention.
Thank you, non-state actors, for your statements. May I now call on the Secretariat to respond to the points that have been made?
Thank you so much, Chair, and to the member states and non-state actors for your really valuable contributions over the course of the discussion today. We've been delighted to hear from you across the full breadth of the Western Pacific, large and small countries, highly developed and developing, all emphasizing the importance of using communication strategically to improve health and well-being across a range of different areas, from tackling NCDs to improving the uptake of vaccines and encouraging compliance with public health and social measures. We're really grateful for the support that member states have expressed for the Regional Action Framework on C4H, and we're really pleased to hear that it's a useful contribution to your work. We've taken very good note of the requests for technical support from WHO for its implementation. Many of you have emphasised challenges related to geography and connectivity. And while recognising the risks and opportunities presented by digital communication, including infodemics and mis and disinformation, you also called on the need to continue engaging with communities offline to truly listen to, understand, and respond to their particular concerns and needs. Countries have highlighted the need to continue building on the many lessons of COVID-19 and to ensure that these principles and practices are part of the preparedness and response efforts that we work on together as WHO and member states for future emergencies. Member states and our non-state actors have highlighted the importance of taking a people-centred approach and the need to invest in capacity for leveraging behavioural insights to understand the factors that really drive health choices and behaviours and ultimately outcomes. We've heard you talk about the value of gathering and applying evidence and for measuring and evaluating outcomes of communication interventions. We've heard the need for capacity enhancement and making sure that at the national and subnational level, you're well positioned to be able to contextualise communication to the needs of the people that we serve, including those who might be particularly vulnerable or hard to reach. And several of you noted the crucial role played by health workers as trusted sources of information for the communities that they serve. And we've taken good note of the need to help build their capacity and enable them to help play that important role in implementing this approach. We've also been delighted to take note of the offer from some of the member states to share their experience in implementing and applying C4H to address various health challenges. As WHO, we are very committed to doing lots of things to try and support you going forward. For example, we're enhancing our own technical capacity and experience in C4H at both the regional and country level. We heard many of you talk about the need to have that capacity, especially in countries, to support you hand in hand as you make progress taking this forward. We will also continue to build on our strong collaboration with partners in this space, and that includes UNICEF and their network of social and behaviour change experts, our WHO Collaborating Centre for Evaluation of Communication at UTS in Sydney, and the many tech and social media partners that we've been working with over the past several years. We're also going to continue to document and facilitate the sharing of experience and leverage our convening power as WHO to continue bringing together relevant experts and member states and partners in a community of practice. A key next step following endorsement of the framework, if I can be so presumptuous as to assume that it will be, we recognise the need to develop a series of really practical tools and guidance and resources to support operationalisation of this approach. To help countries to identify their needs and take steps to fill gaps, as well as defining a set of targets and indicators to measure and evaluate results. We've already started working on some of this, and we're looking forward to continuing to engage with you and your colleagues in capitals to take all of this forward. Thank you so much.
Thank you very much, Olivia, for your excellent replies. And I would like to thank the member states for the continued commitment to strengthening strategic communication for health in the Western Pacific region. The Regional Action Framework on C4H will help us to achieve our shared goals of making the Western Pacific region the world's healthiest and safest region. The principles and practices set out in the Regional Action Framework will help us work together to ensure that people across the region know how to protect their health and the health of the people around them and feel empowered to make the right choices. Together, we will continue to enhance our skills, deepen our capacities, and apply what we have learned to ensure emergency and non-emergency health communication in the Western Pacific is evidence-informed, people-centered, and evaluation-driven. We look forward to continuing to work with member states and partners across the region to further strengthen and scale up the implementation of the C4H. The Regional Committee's endorsement of the Regional Action Framework on Communication for Health and your commitment to taking forward its implementation will help us to advance our shared goals for improving health outcomes. Thank you very much, and back to you, Chairperson.
Thank you, Ms. Lowe Davis and Dr. Jakob. If there are no any further comments, may I request the rapporteurs to draft an appropriate resolution? That concludes our consideration of this agenda item. Thank you very much. And now it's time for our coffee break. The plenary session will reconvene in 15 minutes at 15:25 hours. Thank you very much. Enjoy your coffee. Okay, welcome back. I hope you enjoyed your coffee and ready to move on to the next agenda item, which is agenda item 12, health innovation document number WPR/RC74/6. May I invite Dr. Ki-Dong Park, Director of Data Strategy and Innovation, to introduce this item, please.
Thank you, Madam Chairperson, distinguished representatives. I'm pleased to share with you for your consideration documents WPR/RC74/6 on the draft regional health innovation strategy for the Western Pacific. COVID-19 has made health innovation more pervasive, involving a broader spectrum of the stakeholders ever than before. At the same time, the pandemic has hindered progress on the health-related targets of the Sustainable Development Goals and heightens the vulnerability of the fragile health systems. Now is the time for fresh ideas, renewed determination to confront uncertainties, and then better collaboration with even more stakeholders to regain momentum and address persistent challenges and emerging threats while ensuring inclusivity. The Western Pacific region has a diverse landscape of the health innovation driven by technological breakthroughs, social innovations, and adaptive policies. However, a misalignment of the values in many innovations has led to economic growth taking precedence over population well-being. Furthermore, the absence of the comprehensive evaluation and evidence generation has impeded informed policymaking necessary for scaling health innovations. Governments and then health ministries must take a leading role in health innovations. This means redirecting growth-driven innovation models to prioritize well-being and equity, while still enabling economic success. This can be accomplished through new forms of the public-private partnership to create win-win situations and then address societal challenges, and by establishing venues for learning and evidence generation. Within the region, opportunities exist for cooperation and then mutual learning. This strategy encourages political commitments to a regional approach that will foster greater collaboration and knowledge diffusion, bridging health disparities within and then between countries and areas. The draft strategy provides a strategic framework for the public sector to actively engage in health innovations to solve problems and then improve health and well-being for the future. The regional committee is invited to consider for endorsement of the draft regional health innovation strategy for the Western Pacific. Thank you, Madam Chairperson.
Thank you, Dr. Park. I understand the Secretariat has prepared a video on this item. Please play the video.
Historically, innovation has driven much progress in public health. Amid the pandemic, health innovations are being harnessed on a wide scale to address emerging challenges. Yet today, many still fail to address persistent or emerging health threats due to inadequate funding, insufficient evidence for scalability, and misalignment of the values between the public and private sector. Many health innovations have failed to adequately address the needs and the concerns of the vulnerable populations. The new regional health innovation strategy for the Western Pacific supports member states to exploit health innovations to shape the future health and the well-being of people in the region. To do this, we must foster a culture of innovation and learning within the public sector, prioritize the health innovation in policy agenda, allocate long-term public financing, and guide and measure the impact of the health innovations to inform policy decision-making. Through bold action, we can pave the way for a healthier and then safer future in the Western Pacific.
Thank you. We will now hear from representatives who wish to speak on this item. Please indicate your wish to speak by clicking the big button on your microphone. May I call on the representative of Vanuatu to be followed by Brunei Darussalam.
Thank you, Madam Chair, and good evening, Excellencies. Health innovation is essential to enhance health and well-being by driving the development of novel solutions to prevent, diagnose, and treat diseases, as well as to deliver healthcare services and healthy environments and promote equity. In Vanuatu, innovative interventions are being implemented by the Ministry of Health with support from WHO in the domains of health promotion, health education, and digital health. Firstly, for health promotion, key innovations include the development of healthy island policies, integrating universal health coverage, primary health care, and a new concept of healthy family. They also include the development of the first National Health Promotion School Policy led by the Ministry of Education and Training in collaboration with the Ministry of Health. Secondly, for innovations in the domain of health education, the Ministry of Health, with support from WHO, implemented a family empowerment program within targeted communities to prevent neglected tropical disease transmission. The Village Healthcare Worker Program training has been prioritized to leverage the benefits of health promotion awareness and community development while promoting equitable access for remote communities. Lastly, digital health has been at the core of health innovation in Vanuatu in various ways, including by strengthening health information for public health management, outbreak investigation, detection and response, population-based cancer registry data, and enabling more efficient clinical service delivery, infrastructure, supply chain, and primary healthcare. These important innovations have the potential to make healthcare more equitable, accessible, affordable, personalized, and effective. Some of these innovations already have generated significant impact for Vanuatu. Others announce promising changes to come. The Ministry of Health of Vanuatu is working hand in hand with WHO to ensure that the benefits of innovations are shared equitably to address health challenges and improve well-being of the whole population. The Ministry of Health of the Republic of Vanuatu is pleased to support the endorsement of the draft regional health innovation strategy for the Western Pacific. Thank you, Chair.
Thank you. May I call on the representative of Brunei Darussalam to be followed by Fiji.
Bismillahirrahmanirrahim. Thank you, Chair. Excellencies, delegates, ladies and gentlemen. Brunei Darussalam would like to thank the Secretariat on drafting the Regional Health Innovation Strategy for the Western Pacific, which echoes our commitment to advancing healthcare through innovation and technology, exemplified by the Ministry of Health of Brunei initiatives in digital health. We welcome WHO's support in health innovation, especially in enhancing capacity building and facilitating implementation of such innovations. Brunei Darussalam have instilled an ecosystem whereby innovation and technology are shaping the way we approach the future of healthcare services. For example, Bru Health, which is mentioned in the document, is the Ministry of Health's mobile application that allows users to book appointments online, perform self-assessment for national health screening programs, and limited access to their electronic medical records. All health facilities, such as hospitals and primary care clinics under the Ministry of Health, uses BruHIMS, an electronic medical record since 2013, and is currently undergoing an upgrade to keep up with current digital health transformations and expanding its use for private hospitals as well as private clinics. Despite these innovations, we still lack trained personnel such as data scientists to maintain and evaluate current implementations, as well as to plan for future health innovations. Therefore, collaboration on capacity building and training Collaboration on capacity building and training initiatives is therefore always welcome to ensure that we have healthcare professionals with the requisite skill sets to effectively navigate the ever-evolving landscape of innovation and health technology. We acknowledge the immense potential of embracing cutting-edge solutions such as artificial intelligence, assisted point-of-care diagnostics, wearable health devices, digital therapeutics, and genomics. These breakthrough innovations offer exciting prospects for elevating the quality of effectiveness in healthcare delivery. Similarly, we recognize the importance of global health data sharing and analytics, emphasizing the gravity of health data sharing for purposes such as surveillance, early warning systems, and epidemiological research. Leveraging data analytics for AI for disease monitoring and predictive modeling, as well as health promotion and disease prevention for at-risk populations through early detection and intervention are integral to our approach. However, while these innovations and technology may be valuable and exciting, they tend to be quite costly, both at the initial implementation and ongoing usage. So how can we ensure that in using digital innovation to make healthcare more accessible, efficient, and patient-centric, it is also at the same time cost-effective, affordable, and accessible for everyone, and now and in the future? To conclude, Brunei Darussalam endorses this strategy document and look forward to collaborating with other member states in implementation of health innovations as well as capacity building in this area. Thank you.
Thank you. I call on the representative of Fiji to be followed by Tuvalu.
Thank you, Honorable Chair. Fiji acknowledges and thanks the Secretariat for the draft Regional Health Innovation Strategy for the Western Pacific. For some small developing states like Fiji, innovation had been one of the so-called silver lining of the COVID pandemic. During the pandemic, Fiji acquired and started to build diagnostic capacities in molecular antigen testing, rapid antigen testing, and genomic sequencing. We also started to use single-unit portable oxygen concentrators for patients. And we piloted telemedicine initiatives that included a form of teledentistry and a telehealth phone system. These allowed patients to be connected to any specialist care, which included mental health. They also allowed medicines to be brought to them when they needed it, and also for them to have access to food rations when they were under lockdown. We also started our locally created contact tracing mobile app, and we were able to strengthen mobile-based disease surveillance while increasing our social distancing activities. While their use are now minimal and have stopped for some, they speak to the need for healthcare workers to be able to innovate to deliver health services in challenging circumstances when face-to-face consultations are not possible. We have also recently launched our new digital health strategy that will guide our health information technology development over the next 5 years. This strategy is a good enabler that will help in facilitating innovative approaches that our health professionals can pursue to enhance the efficiency and effectiveness of health service that provide. Fiji fully endorses the draft regional health strategy for the Western Pacific region and calls on WHO and other partners to assist member states, and in particular our health educational institutions and universities, to build capacity in health innovations, governance, finance, sustainability, and evaluation. We also encourage our more developed member states in the region that they, rather than waiting for the next pandemic, initiate actions and begin to assist less developed member states in accessing innovative approaches and technologies that they have developed that can improve and advance the way we deliver healthcare to our people. Thank you, Chair.
Thank you. I call on the representative of Tuvalu to be followed by Kiribati.
Thank you, Madam Chair. Tuvalu supports and endorses the framework on the regional health innovation strategy for the Western Pacific. Because of our remoteness and where islands are scattered around the vast blue oceans, we managed to continue delivering and rolling out our services to those who reside in the outer islands through telemedicine consultations and clinicians from health clinics in the outer islands. As we all know that
there are always associated evolving challenges that may arise when you try and introduce a brand new initiative. From our experience, some of our renowned noticeable challenges we face during this time was the poor internet connectivity in some of the out islands and limited resources they have. The limited resources in some of the out islands didn't allow us to fully execute the maximize the entire concepts of telemedicine in all islands of Tuvalu. However, that didn't hinder our efforts in making sure we can better serve our populations, particularly those residing on the out islands. Moving forward in our efforts to counter those challenges, one of our priorities in the health sector is to identify and determine some of the best possible ways we can implement to enhance internet connectivity in all other islands of Tuvalu, and how we can best maximize utilizing it. I urge WHO, Madam Chair, to continue supporting and working closely with member states in solving those associated challenges and ensure that the technological interventions is fully utilized and easily accessible to everyone. Thank you, Madam Chair.
Thank you. I call on the representative of Kiribati to be followed by Japan.
Honorable ministers and delegates, ladies and gentlemen, again, Maori and greetings to you all. This afternoon, we discussed a very important topic that is critical for improving health outcomes in our respective countries and the region at large. In the past few days, we have heard the phrase thinking outside the box used in a number of interventions and during panel discussions. Innovations, ladies and gentlemen, is not optional, but a necessity in our quest for better health outcomes. It is about challenging the norm, pushing boundaries, and finding new ways to address health issues and challenges. Honorable Chair, I want to point out that with varying degrees of health advancements and level of health development in our region, what will be considered as an innovation in one country might not be considered as an innovation in another country. A good example is the use of digital solutions to streamline health service delivery and management of health services. The use of digital solutions that are already well-established, mainstream solutions in bigger and more developed countries will be considered as innovations if adapted and introduced in my small island country. We acknowledge that innovation in healthcare cannot thrive without supportive environment and investment. We agree that the role of leadership is critical, with health leaders and health partners needing to recognize the importance of innovation and provide the necessary resources and incentives to drive change. This includes supporting research, fostering a culture of questioning the status quo if things are not progressing as expected, and creating policies that promote a culture of innovation. As a small island nation with limited resources, we find that efforts to test new ideas and solutions is often challenged and restricted by the lack of funding. As an example, to address our high child mortality rates, we have been wanting to trial a community outreach program to facilitate early identification of high-risk children in their respective homes. This would be a version of New Zealand's Plunkett program, but adapted for Kiribati. However, piloting this new program has stalled due to the lack of funding. Ladies and gentlemen, Kiribati proposes that WHO and partners consider providing opportunities for seed grant funding to support economically challenged countries with piloting of their health innovations supported by rigorous evaluation. Kiribati also proposes that WHO establishes more comprehensive repository of context-specific examples of health innovations grouped by health topics, which can be searched easily, especially innovations that have been proven to be effective. Ladies and gentlemen, we thank WHO for putting together this strategy, and Kiribati endorsed this draft regional health innovation strategy for the Western Pacific. Kamraba, and thank you.
Thank you. I call on the representative of Japan to be followed by Mongolia.
Thank you, Madam Chair. Japan appreciates the initiative and the efforts of the UPRO's Secretariat. We agree on the importance and the necessity for development of health innovations. First, we believe that government need to collaborate with private sectors in order to generate good health innovation. Therefore, Japan has been encouraging private sectors to develop innovation through human resource development and financial aid. At this point, we assume that it is necessary to pay attention to net causing health risks and the digital divide by those innovations. Next, I would like to point out that more specificity is required in order to steadily advance health innovation. On the draft of strategy, WHO should clarify the priority area of health innovation, the strategy time frame, monitoring indicators, and the target values. Finally, in health innovation, we recognize that complex approval system may hamper development. To promote health innovation, we hope that WHO will play a leading role, including how the approval system will be adjusted. I thank you.
Thank you. I call on the representative of Mongolia to be followed by Cambodia.
Thank you, Madam Chair. The government of Mongolia has been committed to making healthcare services more responsive and equitable to the needs of the population, especially of the most vulnerable and hard to reach populations, including undocumented migrant populations, as well as those residing in geographically distant communities. The COVID-19 pandemic has highlighted the importance of innovative approaches, including outreach services, to ensure continued delivery of essential health services, including maternal, child, reproductive health, as well as the prevention and control of communicable and non-communicable disease and emergency medical services. As such, from 2020, my government started introducing innovations related to delivery of essential health services and COVID-19 services through intensified online primary healthcare services using modern technologies such as mobile health technology and telemedicine approaches, in addition to continuously organizing capacity building and refresher trainings of PHC workers using virtual platforms. Such innovations have been kept for routine healthcare services beyond the COVID-19 pandemic. In addition, around 70% of primary healthcare facilities in the rural provinces now use mobile health technologies and tools to provide essential diagnostic services to people living in remote areas. Backfelchers or Zoom doctors carry out their routine home visits to nomadic families and provide diagnostic services right at their home. Images of ultrasound and ECG records can be sent to referral level hospital for a second opinion or e-consultation using a tablet that is included in the mHealth package. This mobile health technology was first introduced in 2018, and since then the national and local governments have recognized the importance and cost effectiveness of using these technologies in reaching out to remote and disadvantaged population to provide integrated services along with the use of other essential diagnostic equipment and tests. We believe that this is a good example of the investment and expansion of the primary healthcare services. Madam Chair, Mongolia looks forward to further support from the Regional Office for adaptation of the draft Regional Health Innovation Strategy for the Western Pacific at country level. On this note, Mongolia endorses this draft regional strategy. Thank you very much.
Thank you. I call on the representative of Cambodia to be followed by Lao PDR.
Honorable Chair, Excellency, ladies and gentlemen. I would like to express my sincere appreciation for the effort of the WHO Secretariat in finalizing the draft Regional Health Innovation Strategy for the Western Pacific. Like many other countries in the region, Cambodia public sector has significantly benefited from technological advancement and digital penetration over the last decade. The use of technology, both data and digital, is a strategic approach to health innovation is a priority for our new government. In the health sector, innovation has been integrated into the new national health strategy and is a core focus area of the primary healthcare booster implementation framework. Technology and community engagement serve as a key driver for health sector to stay ahead of the curve and transform itself. Cambodia is committed to enhancing multi-sectoral collaboration and fostering public-private partnership to improve equitable access to health services. Additionally, strong community engagement is crucial to increase the utilization of PAC services, and social innovation approaches will lead to improved health outcomes for Cambodian people. Simultaneously, we are in the final stage of developing the National Digital Health Strategy. The Ministry of Health established a Digital Health Committee to oversee the design, implementation, and evaluation of all new digital health programs aimed at transforming the health system. Beyond the application of digital technology, decentralization is another key aspect of innovation in Cambodia. During the COVID-19 pandemic, Cambodia introduced a master plan that emphasized strengthening local and provincial preparedness for outbreak of COVID-19, influenza, and other respiratory diseases. In collaboration with WHO and other partners, the Ministry of Health designed and deliver a set of activities to enhance local capacity for surveillance, reassessment, and rapid response throughout the country. Cambodia on path toward building strong provincial surveillance capability, which will add effective operational strategic decision-making during ongoing of the future pandemic. Cambodia welcome the regional innovation strategy for the Western Pacific and look forward to collaborating with WHO and all member states to further enhance our capacity in health innovation and share our best practice and lesson learned with the region. Thank you very much.
Thank you. I call on the representative of Lao People's Democratic Republic to be followed by Samoa.
Honorable Madam Chair, Acting Regional Director Dr. Susanna Jacob, Honorable Health Ministers, distinguished ladies and gentlemen. Globally, there has been a trend towards investing in the digitalization and innovation of healthcare. In Lao People's Democratic Republic, we have made the enormous investments to build the health information system across different programs and introduce digital technologies into the healthcare system with support from WHO and various development partners. To move this effort toward, we launched the National Digital Health Strategy 2023 to 2027 in January this year, marking a significant step towards leveraging the digital technologies for the enhancements of the healthcare delivery. In these strategies, we have identified 5 strategic priorities, which are governance, workforce, infrastructure, standards, and applications. These priorities are expected to create a foundation for the streamlined health services in data-driven decision-making. To implement this strategy effectively, the interoperability of data across the different health information systems and establishing a unique differentiator are identified as the key issues. The implementation of the unique health identifier stands as the likely requirements for the digitalization of healthcare. It serves as the foundation upon which the interoperable health information ecosystem is built. With a unique health ID, individual can securely and accurately access their medical records across the various healthcare providers and settings. Beyond individuals, it benefits the entire countries by collecting essential health data, benefiting government and health professionals in decision-making. We have established the unique health ID format for citizens with the plan for widespread dissemination soon, a big step towards digitalization. I would like to highlight another innovation aspect health sector from the evidence-based decision making. In our countries, where resources are still limited, the abilities to making information decision make regarding healthcare allocation can be lifeline for many with WHO support. The Ministry of Health collected and analyzed the multi-source data, focusing on mapping and geographic distribution. Areas where the healthcare services were lacking and identify the match with the reallocation of the healthcare staff to improve the coverage. This approach provided a comprehensive understanding of healthcare service distribution, enabled targeted interventions and optimal use of the resource, and empower authorities to make the information decision. Furthermore, climate change is reshaping the landscape and changing the public health in the countries, changing weather patterns demand action and safeguard to the well-being of the people. We have responded to this by integrating meteorological data, including daily temperature and rainfall, into the health management information system. This integration allows the better understand to links between climate and health and improve the ability to forecast climate sensitive health conditions. Collaboration between the Ministry of Health and Ministry of Natural Resources and Environment play a crucial role in this effort, integrating meteorological data and clarifying the governance data, focusing on collaboration, listing awareness to allow the address climate introduce health challenges effectively. With our government's strongly commitment toward health innovation, we fully support the draft regional health innovation strategy of the Western Pacific. I thank you.
Thank you. I call on the representative of Samoa to be followed by Malaysia.
Thank you, Madam Chair. Excellency, ladies and gentlemen. Samoa would like to congratulate our regional office for developing the draft Western Pacific Region Innovation Strategy to assist our governments in utilizing health innovations to shape the future of health and well-being of our people. For Samoa, our government through the Ministry of Health as leading agency for Samoa's health sector remains committed in promotion of health innovation by fostering digital health innovation through utilizing e-health project development to boost mass community health programs rolled out across the country, such as measles epidemic and COVID-19 mass vaccinations, Pain for Samoa program, NCD screenings, lymphatic filariasis, mass drugs administration, improve patients' records, and enhance disease surveillance services. Promote social innovation in health through strengthening community participation and involvement in delivering of community-based health programs and activities such as conducting basic health screenings as part of Pain for Samoa program rollout, assisting the Ministry of Health with the mass drug administration for lymphatic filariasis elimination and other primary health care programs. To conclude, Samoa fully supports the recommendations to endorse the Western Pacific Region Innovation Strategy and will continue to formulate and implement new health developments that Samoa firmly believes will contribute in improving health and well-being of our people. Pak Fitai.
Thank you. I call on the representative of Malaysia to be followed by China.
Thank you, Madam Chair. Malaysia takes note of the draft of the Regional Health Innovation Strategy for the Western Pacific. Health innovation certainly plays a big part in transforming health and equity for the well-being of the population. Some of the major challenges in this regard are insufficient funding and availability of worker forces, lack of infrastructure, and emerging health security threats. To address these challenges, governments must set the direction for health innovation, strengthening investment in research and development, and form a collaboration among different stakeholders for knowledge exchange. Malaysia has invested in digital health to escalate access to quality healthcare. The aim is for the electronic medical record EMR system to be rolled out in all government hospitals and clinics. This will consolidate and standardize medical information from all the public hospitals and clinic systems to improve continuity and quality of care, to upgrade the health population data that enables better healthcare decision-making and improving quality of care. A more complete approach to digitalization of primary healthcare services is done through electronic health records known as tele-primary care, oral health clinical information system is TPC-OCHIS, which is a complete solution for both health and dental services in the government health clinics. In addition, Ministry of Health has also rolled out cloud-based clinic management system in health clinics around Malaysia at scale, speed, and low cost with high impact. Rollout of this system enables health clinics to digitalize their work process, and this in turn empowers the clinics to deliver high quality, efficient, and patient-centered care. The pandemic era has seen the importance of digitalization in health service delivery. Online appointment system facilitates in reducing the huge number of walk-in patients to government health clinics, hence reducing further the risk of infectious disease transmission in the clinics. Another new initiative tested out during the pandemic was virtual health advisory and virtual clinics, which in turn help healthcare providers to manage known NCD cases better as there are curfew on traveling to and from certain areas. Malaysia launched the MySejahtera mobile app amidst the pandemic. It stands out as a remarkable innovation that has offered tremendous benefits to the healthcare system that serves as a digital front door for public healthcare services. Malaysia has also developed a framework for rapid adoption of healthcare-related products and utilize emerging technologies to improve healthcare service delivery. With that being said, Malaysia is pleased to endorse and fully support the draft of Regional Innovation Strategy for the Western Pacific. Thank you.
Thank you. I call on the representative of
接下来呢，请中国代表发言。中国代表发言以后呢，是菲律宾代表发言。Distinguished Madam Chair, ladies and gentlemen, good afternoon. I'd like to thank WHO for all your efforts under the current circumstances. Stepping up health communication is becoming all the more important. China agrees with the West Pacific Regional Health Innovation Strategy. We will continue to work towards its objectives. Science and technology innovation is an important element for mankind to cope with risks and challenges. And China attaches a great importance to health innovation. We've always given top priority to people's health. We are implementing an innovation-driven strategy with a high quality development in our healthcare endeavors. We have constantly carried out healthcare technology cooperation with all countries and international organizations with platforms of exchanges and various mechanisms. We have promoted clinical research, translational research, education, and other exchanges. We have stepped up surveillance and management of NCDs and environment, climate change related threats, as well as vocational health. With the last pandemic, which came unexpectedly, China enjoyed the support from many countries. We carried out humanitarian operations on a global scale. We contributed our wisdom and capabilities to the global fight against the pandemic, because since the outset of the pandemic, based on principles of openness, transparency, and responsibility, we lived up to our international obligations. And with no time lost, we informed international organizations, countries, and other stakeholders about the genome information of the coronavirus and other relevant information. We have carried out pandemic response exchanges with other countries, sharing information without any reservation. Despite our own tremendous pressure, we did our best to provide assistance to the international community. 220 plus countries and international organizations. We provided more than 2.2 billion doses of the vaccine. boosting the global efforts of response. So with the last pandemic, which was an emergency, it has reminded us of the fact that our world has evolved to be a global village and community of a shared future for all. So for everyone to enjoy health, it is a common aspiration for entire humankind. Building a community of a shared health for all, it is China's proposal for the global health endeavor and an extension of the notion of a community of a shared future for mankind. Together, working with the WHO and others with open-mindedness, we are ready to promote international science and technology cooperation on health with translation of more research findings into practice so as to make West Pacific into the safest and healthiest region in the world while making new contribution to the well-being of mankind. Thank you.
Thank you. I call on the representative of Philippines to be followed by Hong Kong, China.
Thank you, Chair. The Philippines supports the endorsement of the Regional Health Innovation Strategy for the Western Pacific. This strategic document is a significant step to promote innovation in our region, and it will play a crucial role in informing policies and fostering a culture of innovation in the health sector of member states. We highlight the important role of anticipatory governance in establishing a thriving innovation ecosystem in the region. It will help policymakers develop strategies and solutions to safeguard health in the face of evolving health landscapes and ensure that the innovation ecosystem remains resilient, responsive, and capable of meeting the needs of the future. Innovation strategies, policies, and systems should have a humanistic approach. Humanistic health innovation policies and systems should focus on the individual patient, the relationship between patients and their providers, and the value of human dignity. Finally, the Philippines also strongly advocates for mainstreaming health data governance principles to promote the use of data consistent with international laws and human rights obligations such as data protection laws. Thank you.
Thank you. I call on the representative of Hong Kong, China to be followed by Republic of Korea.
Madam Chair, distinguished guests, ladies and gentlemen, Hong Kong, China expresses appreciation to WHO's teams for formulating the Regional Health Innovation Strategy for the Western Pacific. We support and endorse the strategy. The COVID-19 pandemic has brought a big paradigm shift favorable for the development of innovation and technology. It has advanced cross-border and cross-organization data sharing and accelerated public acceptance and wider application of electronic health records, mobile devices, online services, and artificial intelligence to different aspects of disease control. Hong Kong has in place comprehensive mechanisms for surveillance of communicable diseases. In response to the COVID-19 pandemic, we have further developed several innovative smart information systems. For instance, online self-reporting platforms were developed to improve timeliness in capturing demographic and epidemiological data, and improving subsequent case management workflow, like issuing isolation and quarantine orders, distribution of goodie bags with essential personal care and infection control items, to support those under home isolation or quarantine, arranging transfer of cases to isolation facilities, and so on. New surveillance strategies like sewage surveillance were adopted for tracking the activity of COVID-19. Genetic characterization is also conducted on samples of sewage and human samples from severe cases, with results along with other surveillance findings disseminated to the public as well as sharing with the WHO. Although the containment phase of the COVID-19 pandemic has passed, new public health challenges continue to emerge, such as mpox, antimicrobial resistance, vector-borne disease. We are also not spared from non-communicable diseases in the community. We must keep abreast of the latest innovations, monitor diseases and high-risk factors, accurately analyze data, and formulate countermeasures promptly. Taking reference from the COVID-19 experience, we are planning to develop an integrated IT system to integrate and enhance the various IT initiatives developed during the pandemic for better handling of COVID-19 and extending the use of IT for better preparedness and response to emerging infectious diseases. We look forward for Wipro to develop guidelines and protocols, in particular to manage new technologies such as AI and big data analytics. Wipro's leadership is important to foster more experience sharing and collaboration. Thank you.
Thank you. I call on the representative of Republic of Korea to be followed by Cook Islands.
Thank you, Chair. The Republic of Korea acknowledges the importance of health innovation in the Western Pacific region and appreciates the Wipro for its hard work to establish common regional strategy. As mentioned on the report, health innovation also has to be targeted towards achieving the ultimate goal of the healthcare policy, health for all. Korean healthcare sector was relatively slow in digital innovation. However, as we went through the COVID-19 pandemic, telemedicine, such as non-face-to-face treatment, was temporarily allowed, and we have started active discussion on digital innovation in healthcare. Besides treatment, there has been digital innovation being made in health management service where people take a lead in health promotion activities with expert support. The RK fully agrees with the need to boost health innovation capacities of the public sector. As part of our efforts for supporting innovation, we have a pre-introduction system in place which speeds up health insurance listing of new health technology. With this system, we are making new health technology proven to be safe available in the market before conducting new health technology assessment. And we also acknowledge the significance of R&D in health innovation as well as technological innovation. We believe that sharing experiences and cases will motivate member states to make innovation, and it will serve as a driving force for further health innovation down the road. The RK will step up its efforts to advance health innovation, taking into consideration objectives and measures suggested in the report. I thank you.
Thank you. I call on the representative of Cook Islands to be followed by Palau.
Thank you, Chair. Kia ora, and again, warm Pacific greetings to our acting RD-elect, honorable ministers, distinguished delegates, officials, development partners, ladies and gentlemen, a very good afternoon to all of us. As a small island state in the context of the Western Asia Pacific region, as we face significant workforce challenges and resourcing needs in the delivery of quality healthcare across our islands to the most far northern part of our Cook Islands, over 2 million square kilometers. This calls for staff innovation and technology transformation. Many innovations fail to address these challenges due to the current economic situations post-COVID-19, insufficient investment into health budgets, and the lack of fit-for-purpose health innovation models. The development of these regional health innovation strategy for the Western Pacific is welcomed. Moving our health system to a growth-focused innovation models towards improved well-being and equitable access for our people be prioritized. This strategy will also guide scaled-up social innovation initiatives and develop enabling environments and to maximize the use of health technologies and telemedicine opportunities. The 15th Pacific Health Ministers meeting were heartened by the progress made in advancing health and information systems and digital health during our COVID-19 pandemic responses, and acknowledge that we need to be ready for any health system shocks that may occur in future. We must be committed to develop core essential healthy service delivery and innovation packages so that our health system can continue to operate business as usual services and public health emergencies as required with minimal interruptions. My government, the Ministry of Health and WHO have secured key equipment to integrate technology or telemedicine services in the delivery of healthcare in our remote islands. However, internet connectivity remains a challenge. So in closing, the Cook Islands supports the endorsement of the Regional Health Innovation Strategy for the Western Pacific. I thank you, Chair.
Thank you. I call on the representative of Palau to be followed by USA territories.
Thank you. Honorable Chairperson, honorable ministers, esteemed colleagues, ladies and gentlemen, good afternoon. Palau regards health innovation as a critical component for health system strengthening and resilience in our region, especially in small island development states such as Palau. As such, we welcome and endorse the Regional Health Innovation Strategy for the Western Pacific. As we had all experienced in the COVID-19 pandemic, closed borders and mitigative measures forced us to rapidly learn and utilize new technology and platforms to communicate and maintain service delivery in a safe and sterile environment manner. Through this experience, we have come to realize the potential that technology can afford us in the delivery of health services in the islands. However, as we seek to invest more into new technology and digital platforms, we also need to ensure that adequate legislative and regulatory frameworks are developed and set in place to allow for the safe launch and use of technology. These frameworks should be established to ensure patient information privacy and protection with data archiving and sharing platforms such as EMRs and EHRs, and should also have clear protocols for provider licensure and indemnification protection for telemedicine initiatives, just to name a few. In supporting the endorsement for the Regional Health Innovation Strategy for Western Pacific, we believe that it shall serve as an essential roadmap for the region and will guide us as we move to invest and deploy new health technologies in the region. Thank you, Chair.
Thank you. I call on the representative of USA territories to be followed by Australia.
Madam Chair, Secretaries, Ministers, Delegates, ladies and gentlemen, our partners. The United States Territory supports the Regional Health Innovation Strategy for the Western Pacific. We appreciate the continued improvement of health innovation in the region through a multifaceted approach that continues to foster partnerships between government leadership and private sector companies within and among our member states. With a framework that drives innovation while ensuring safety and quality standards, it is critical to encourage through investments, research and development supported by data and analytics to advance healthcare technologies, medicines and treatments to address our health challenges. More work is needed to promote the use of telemedicine to reach our underserved areas. We must also consider providing the equipment for telemedicine and improve access and utilize innovative data analytic systems to monitor health trends, identify areas of need, and use the data to reshape our health innovation efforts for our island communities to improve access to healthcare services. Collaboration is vital for our territories to ensure innovative technical knowledge and resources are shared by member states to help meet healthcare priorities. Innovation, investment, and technical assistance in training for capacity building will empower our people to take control of their health and enable our healthcare professionals to keep up with the latest innovations and technologies. American Samoa and in absentia, the Commonwealth of the Northern Mariana Islands in Guam appreciate the opportunity for continued multi-sectorial support on health innovation. Thank you.
Thank you. I call on the representative of Australia.
Thank you, Chair. I'd like to begin by expressing Australia's support for continuing to develop innovative health capabilities in our region. We note that innovation in health, and in particular, digitalisation, has an important role to play as a part of a modern and accessible healthcare system. Strong direction, strengthen public health sector capacity, and investing in ecosystems for health innovation will improve country readiness to innovate and adopt new practices and technologies. In Australia, COVID-19 accelerated the adoption of technological innovations such as telehealth and e-prescribing. Consumers and healthcare providers embrace the benefits and convenience of digital technology. Social innovations also help to manage public health risks. This included changing behaviour to support social distancing, hygiene, and vaccination, which all supported the health system response. We would like to thank the Secretariat for the development of the draft strategy, which we endorse. We support the overall vision, objectives, and key actions in the strategy. We would like to echo some of the suggestions shared by our colleagues from Japan on areas for focus for implementing the strategy, and would also like to encourage focus on identifying short-term and long-term priorities, and to clarify actions for member states and other actors. We recommend consideration of how the strategy links to the global initiative on digital health in the strategy recently endorsed by G20 and coordinated by WHO. The initiative will support digital health readiness and build country capabilities to innovate healthcare in a manner that is safe, secure, and trustworthy. For the full benefits of health innovation to be realised, we support country-specific readiness to innovate and adopt new practices and technologies. Australia will continue to partner with our neighbours to share Australian expertise and build capacity in areas such as digital health information systems through country-led projects and regional cooperation. Thank you.
Thank you. Are there any more representatives who wish to speak on this topic? If not, I understand that there are representatives of non-state actors who wish to make a statement to the committee on this agenda item. Both written and oral statements will be uploaded to the designated RCM webpage and the meeting application. As statements reflect solely the views of the NGOs concerned, it follows that statements do not necessarily reflect the views of the World Health Organization, including its member states and Secretariat. It is my pleasure to call on the representative of the International Federation of Medical Students Association, to be followed by the representative of the Wright Foundation, to deliver a short statement to the Regional Committee.
Honorable Chair, distinguished delegates, health innovation allows us to address complex challenges that persist in the Western Pacific region where diverse health landscapes coexist. The COVID-19 pandemic has further highlighted the potential of digital health in crisis response and management. The International Federation of Medical Students Associations, IFMSA, as a global network of medical students, acknowledges the role of digital health innovation in achieving universal health coverage and advancing Sustainable Development Goal 3. In the journey towards improved health outcome for all, we call on member states to prioritize equity and accessibility to reduce health inequity and structural discrimination. This involves addressing barriers that may hinder access, such as economic constraints, technological disparities, and geographical remoteness. Considering our significant digital involvement and proficiency, we urge member states to recognize the potential of youth in driving digital transformation and leading health innovation initiatives to address challenges in healthcare. As we venture into new frontiers of health innovation, comprehensive digital health curricula and a balance between high-tech and high-touch strategies in the region are in need to enhance patient care and improve efficiency. Therefore, we call on member states to empower medical students worldwide, the current health workforce, patients, and communities with the knowledge and skills to embrace innovation, via digital health education. We stand at a juncture in the evolution of global health, where innovation has the power to redefine our approach to healthcare delivery. IFMSA endorses the WHO Global Strategy on Digital Health 2020 and 2025 by supporting the ongoing digital transformation of healthcare with a focus on ethical, safe, secure, equitable, reliable, and sustainable health innovation initiatives. By recognizing the interconnected nature of health challenges, IFMSA will continuously contribute to health innovation through advocacy, education, and collaboration. Thank you for your attention.
Honorable Chair, distinguished delegates, Wright Foundation expresses strong support for the Regional Health Innovation Strategy for the Western Pacific as a vehicle to catalyze regional level collaboration to drive innovation that is anchored in the value of public health and health equity. Wright Foundation is indeed committed to support innovation in health through providing funding for R&D of health technologies to improve global health equity, especially in LMICs, in the area of infectious disease, especially where there is a lack of market incentives. Among the proposed actions in the Regional Health Innovation Strategy, Wright Foundation would like to express our alignment on strengthening the public sector to drive health innovations, the principles of collective intelligence and the ecosystem approach to create enabling environments for scaling health innovations. Also, Wright Foundation would like to express enthusiasm for the role that WEPRO to represent its member states in the bottom-top approach to reflect the priorities and the needs of the local and regional stakeholders, while serving as a link to the global stakeholders for learning and coordinating across regions. For the successful realization of a regional health innovation strategy, we would like to also emphasize the importance to establish concrete case example of health innovations through active engagement and collaboration with the specific disease or health program areas for highlighting successful case examples of innovation making population-level health impact at scale with well-coordinated public, private, and academia partnership. All in all, we strongly value the importance of innovation in health and would like to express strong support to the Regional Health Innovation Strategy for the Western Pacific to create enabling environments for accelerating impact and improve health and well-being in the region. Thank you.
Thank you, non-state actors, for your statements. May I now call on the Secretariat to respond to the points that have been made.
Thank you, Madam Chairperson. The Secretariat thanks to all member states for your comment and then support to the draft Regional Health Innovation Strategy for the Western Pacific. Allow me to respond to your interventions. First of all, the Secretariat appreciated the example of the health innovation already happening in the region, including data, digital, social, and process innovation for health service delivery. The draft strategy defines health innovation as the creation and implementation of the new processes, products, policies, or systems that improve health and equity. We are encouraged that it aligns with your definition and scope. We heard a clear integration of the health innovation within broader health sector strategies and national digital health strategies. In some nations, innovation enabling policy developments and legislative actions are already underway. The draft strategy underscores the vital importance of the prioritizing innovation policies for health to strengthen governance, accelerate the adoption and then implementation of the health innovations at all levels. Brunei Darussalam, Cambodia, and United States emphasizes the importance of the capacity building in innovation. We acknowledge the statement of the International Federation of the Medical Student Association on their call to empower health innovation ecosystem players via education. China, Hong Kong, Republic of Korea, Kiribati, Tuvalu, Malaysia, Australia emphasize the importance of the supportive environments, investment, research and development, health technology assessment, and the evaluation of the health innovation. Cambodia, Japan, and the United States highlighted the vital role of the private sector in health innovation. Fiji, Tuvalu, Kiribati, and Cambodia proposed a regional approach to facilitate technology sharing and repository. PDR emphasized the importance of the data-driven decision-making in scaling innovation. We welcome the Right Foundation's commitments to advancing health innovation through dedicated R&D funding in health areas lacking market incentives. Japan underscores the challenge posed by a complex certification and market authorization system on the development and the scaling of the innovative products. Malaysia shared its experience in developing a framework for rapid adoption of the healthcare-related products and utilizing emerging technologies to improve healthcare service delivery. Some member states have already implemented the regulatory sandboxing for telemedicine in response to the COVID-19 pandemic. Cambodia, Cook Islands, and Samoa reminded us that innovation is beyond technology. Adoption of the new approaches requires social and then process innovation, decentralization, community engagement, and then whole of society approach can empower local innovation to addressing local problems. Last but not the least, Japan stressed the importance of ensuring that innovation should not pose health risks or widen the digital divide. The Philippines emphasized the importance of the humanistic approach and then healthcare governance principles in protecting human rights and the data protection. Palau emphasized the educate legislation in implementing health innovation. Mongolia, Brunei Darussalam, and Vanuatu emphasized that benefit of the innovation should be equitably shared to improve the well-being of the entire population. Now, allow me to recap on WHO's implementation plan for the regional health innovation strategy. WHO will support the member states in implementing the regional health innovation strategy to achieve objectives for health innovation. We will deliver our support through developing and disseminating norms and guidance on health innovation, enhancing capacity building in health innovation, shaping and then influencing innovation ecosystem, engaging multi-sectoral stakeholders to create an enabling environment for new ideas to be tested, adopted, and then scaled, and facilitating implementation of the strategy in countries. Now, I'd like to invite Dr. Alain Lavric, Director on Digital Health and Innovation at WHO headquarters, to respond to your comment from global perspective.
Thank you, Dr. Park. Madam Chair, Excellencies, ARD and RD-elect, distinguished colleagues and representatives, it's my distinct privilege and honor to be joining you today to reflect briefly on your excellent interventions from the global perspective. Allow me first to extend greetings from our WHO Chief Scientist, Dr. Jeremy Farrar, and his warm wishes to WIPRO member states. Harnessing the power of digital health and innovation is central to achieve the Sustainable Development Goals and accelerate our ambition of universal health coverage. This well-articulated and ambitious regional health innovation strategy builds on the experiences of many WIPRO member states and has taken inputs from many key stakeholders. It's been an exhaustive process that is a testimony to Dr. Jacob and Dr. Park's leadership and their team's hard work over many months. It not only aligns well with our global digital health and innovation strategic vision and priorities, but will serve as a model for other regional plans under development. Innovation and digital health are clear cross-cutting enablers being baked into the DNA of GPW 14 being drafted as we speak, supporting WHO technical areas across 3 levels of the organization to strengthen service delivery, data collection, and systems performance. We appreciate the clear role that is defined in the proposed strategy for the public sector in the innovation ecosystem, and the importance that innovation must be driven by national health system priorities and address unmet public health needs. We must always keep the goal of innovation in focus to serve people, to maximize equity, inclusion, and reach of health programs, to improve efficiencies and reduce costs, and to strengthen person-centeredness, and to support health systems already under stress to meet ever-growing population needs for preventive and curative services already and be contextually appropriate. As many of you have mentioned, we must take into account key enablers like connectivity and bandwidth. Innovations must be science-based, grounded in evaluation and research. And this also confirms the comment from Kiribati that established practice in one setting can be an innovation in another, stressing the importance of peer-to-peer learning and knowledge sharing. As many of you have shared today in your remarks, the COVID-19 pandemic, out of necessity, helped to demonstrate the potential of innovation to support public health goals, to build confidence that these strategies and technologies could be used to strengthen surveillance, to communicate health information to the public, to train health workers and manage complex testing and immunization programs. During the pandemic, WHO forged novel partnerships with major internet companies and communications platforms to successfully combat misinformation on social media and other infodemic concerns. This partnership continues until today and could provide valuable support to Wipro's proposed C4H initiative discussed before the break. Member states has recognized that the pandemic has spurred an important transition away from siloed experimentation and a proliferation of pilot projects to a well-governed and coordinated ecosystem that emphasizes the scale-up and institutionalization of best practices and innovations, where governments are in the driver's seat, setting clear health sector priorities and providing the regulatory environment, the policies, and the standards, as well as the incentives and enforcement necessary for fruitful outcomes. Government is also responsible for placing people at the center of innovation. WHO stands firmly behind this transition away from siloed experimentation to governed ecosystems of scale. As several countries have illustrated today, the key to this process is a clear vision and national investment strategy to drive digital and innovation transformation. I'm delighted also to hear so many examples of leadership in developing new enabling policies that support digital health and innovation across the Wipro region. WHO today, in about 3 hours, is releasing new regulatory guidance on AI for health to help governments working on framing policies that allow us to harness the power of AI to answer important challenges like the specialized workforce gap, while protecting people and systems from harm. We must also continue to examine and amend existing analog era policies to identify those policies which inadvertently create barriers to digital innovation. WHO is committed to supporting countries across its 3 levels by strengthening human capacity through competency-based training, evidence-based guidelines on best practices, implementation norms and standards, and multi-stakeholder and expert convening. We agree fully with several member states on the importance of continued research and evaluation to ensure that these investments are impactful, cost-effective, and sustainable. WHO HQ will be supporting this regional strategy through the development of global digital health and innovation competency frameworks inspired by WHO Wipro's data competency framework. Over 1,600 government officials from over 100 member states have so far been trained as part of ongoing capacity building initiatives in planning national digital health systems, with over 16,000 people trained on the ethics and governance of AI for health. We want to further congratulate member states on highlighting the importance of local capacity to generate, adapt, and sustain digital health solutions and innovations. This is part of the fabric of building resilient health systems. By engaging local entrepreneurs and the private sector in delivering on a shared mission of better health for all, we increase the sustainability of programs with fewer external dependencies, while recognizing the variability of country priorities across this region. As an example, WHO has worked with Google to support the launch of Open Health Stack, that is a suite of tools for developers to build local Android solutions that meet global standards for interoperability, shortening the time to develop software, reducing costs, and supporting domestic entrepreneurs in service to the public sector. We agree that this shift represents a transformation of systems from an analog paradigm of the past to a digital reality of the future, and will require investments in capacity building, infrastructure, and foundations that we mentioned earlier. And we have learned that without solid foundations, whatever we build is doomed to be short-lived. Digital public infrastructure and innovation ecosystems are necessary to build this possible future. In support of this, WHO recently launched 2 global initiatives. First, a global initiative on AI for health, to strengthen collaboration and development of standards. And second, a global initiative on digital health, putting countries at the center, helping to measure and articulate needed investment, technical support, secure resourcing, and ensure quality assured technical support to digital transformation. Lastly, the strategy encourages the importance of partnerships between countries through initiatives like the Global Digital Health Certification Network, which was launched in July of this year. This network will facilitate the free movement of people across borders, as emphasized by several member states in their interventions. This network facilitated the verification of credentialed health certificates issued by member countries, as we saw during COVID in test and vaccine QR code and digital certificates. We're working to extend this to include vaccination and health records for travelers and migrants, for cross-border telemedicine and other use cases. Our DG, Dr. Tedros, recently extended an invitation to all member states to onboard to this WHO-managed network. I'd like to close by once again congratulating Wipro colleagues and member states in championing this groundbreaking innovation strategy, and we extend our full support in implementing these objectives for everyone, everywhere, leaving no one behind as we work to achieve health for all. Thank you.
Thank you, Dr. Park. Thank you, Dr. Labrik. If there are no further comments, may I request the rapporteurs to draft an appropriate resolution. That concludes our consideration of this agenda item. Thank you very much. We have now reached the end of today's session. We will reconvene tomorrow at 900 in the morning, Manila time. I would like to invite the Acting Director of Administration and Finance, Mr. Agarwal, to remind us of the details.
Thank you, Madam Chair. Just a very short announcement, especially given that we are approaching the end of the regional committee tomorrow, and just to facilitate smooth airport transfers, etc. for everyone. So for those who have not yet received the airport transfer flyers, we kindly request you to visit the WHO desk at your respective hotels for proper transport coordination. And second, as Madam Chair said, that tomorrow's session, it will begin at 9 a.m. in this conference hall. So there will be transportation from the Manila Hotel and Sheraton Hotel starting at 8:30 a.m. With that, I hand it over back to you, Madam Chair.
Thank you, Mr. Agarwal. And thank you all for participating actively in today's deliberations. Thank you very much again and see you tomorrow.